Good morning. I'd like to welcome you to the meeting
Not
of
yet.
I knew that.
Everything is a little slow today.
Good, so are the rest of us.
Okay, we're good. Go ahead, Marita. Go ahead, Marita.
Good morning. Good morning. Welcome to the Board of Supervisors meeting. And this morning, the City Council is also joining us. So, Mayor, would you like to call your City Council to order, please?
Welcome to the joint meeting between the Board of Supervisors and City Council of Angels, meeting of May 12th, 2020.
Mr. Mayor, did you want to do a roll call vote for any reason?
I think Diane's going to do that.
I am. So, Mayor Joseph Oliveira.
Present.
Veronica Matilde. Amanda Fuldorf.
Present.
Linda Herman.
Present.
Alvin Brolio.
Present.
Thank you very much.
Thank you. Mr. Mayor, would you please lead us in the Pledge of Allegiance? And if all of you could stand and maybe unmute so you could hear, I'd appreciate it. Thank you.
Wait for the flag. Pledge allegiance to the flag.
States of America. And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I think we need choir lessons.
That lacked a little harmony, didn't it?
We have Laura for the staff announcements. Yep.
Are there any staff announcements?
Yes, there is, Madam Chair.
Okay.
Hold on one moment, please. There's hello, Kristen Stranger.
Yeah, she's on.
Oh, so should Laura from Health and Human Services, you can start your announcement now.
My name is Laura Wilson. I'm the deputy director with Calaveras County Services.
It's not clear.
Okay. Laura, we're going to turn your video off, but your microphone is not on. She has 2 logins.
What would you like for us to do? Maybe you can use. You want to use this?
Laura, I think we may need you to call in because we're not hearing anything that you're saying.
We've called in. Sanders is calling in. Or I think if you have everybody in the same room, multiple things on that go, it's just one menu.
Laura, if you have two people in the same room, you're probably experiencing feedback. Maybe we could take a 5-minute break to see if we could figure out the issue that we're having, Madam Chair and Mr. Mayor.
Fine. Mr. Mayor, is that okay? It's okay.
Okay, so we'll look at 9:15 to reconvene at this point, okay?
Okay, thank you.
Thank
All
you.
right.
Have you start. Okay, you can go ahead, please, with your announcement.
Okay. Good morning, everybody. This is Judge David Sanders. I'm going to be reading a staff announcement regarding a new court we're going to be starting called Team Court. First, I want to acknowledge everyone who has signed and is a co-presenter along with me. There's Julie Spoljarek, Deputy County Counsel, Laura Larson, Deputy Director of Calaveras County Social Services, David Stackman, Deputy Director of County Behavioral Health Services, Rob Fulgham, Supervising Substance Use Disorder Counselor, Jomo Stewart, attorney who represents parents in Dependency Court, Patrick Keene, an attorney who represents the children in Dependency Court, and David Singer, an attorney who represents parents in Dependency Court. And our announcement is that the Calaveras Superior Court is pleased to announce a new drug court associated with the Juvenile Dependency CPS calendar, which will be conducted starting tentatively on June 2nd, 2020. It's officially called Team Court, which stands for Together Each Achieves More Court. This will be a voluntary court program designed to address the impacts of substance use and abuse, what can have on a mother or father's ability to parent their children. Hearings called meetings will be conducted weekly on Tuesdays prior to the regular dependency hearings. These meetings are intended to be informal, friendly, and supportive, serving as an additional tool to support parents struggling with substance abuse to find their way to sobriety as part of their effort to reunify with children who have been detained. The meetings will be conducted by Judge David M. Sanders, that would be me, in my role as presiding judge of the juvenile court and unified family law judge without the presence of a clerk. The only record of these meetings will be my notes. Team Court will consist of 3 phases. Phase 1, a foundation of recovery. Phase 2, embracing recovery. And Phase 3, maintaining recovery. Weekly Team Court meetings will be preceded by me conferencing with service providers, attorneys involved in dependency proceedings, and the social services liaison progress and struggles since the last meeting. Others who may attend but not participate in Team Court sessions are attorneys, substance use treatment providers, social services liaison, support persons or social workers if invited by the participants, and others with judicial permission. Initial eligibility for the program will be decided by the pre-meeting conference team. Ongoing eligibility is a matter of judicial discretion, taking into account factors such as attendance, attitude and participation, and progress. Additional considerations include any discharge from treatment, subsequent convictions, or being under the influence at Team Court meetings. To further the goal of Team Court as a support for participants, those struggling with sobriety may be given homework such as essays, activities to do outside the context of the meetings, or other ideas suggested by participants at the meeting. Incentives and rewards may be offered for participants who are doing well or achieving milestones. Ideally, these will support activities involving the participants and their children. As an example, Walmart has made a generous contribution of gift cards. Any businesses or individuals who may wish to donate any kind of incentives are welcomed and encouraged to contact Farrah Roberts, CASA Program Director, at either froberts@nexusyfs.org or 209-754-9816. Successful completion of all 3 phases will result in a participant's graduation from Team Court. The purpose of graduation is to recognize the significance of their accomplishment and to emphasize the difference between sobriety and being in recovery. Recovery is a lifelong process requiring a firm commitment to sobriety and surrounding themselves with people, places, and things that help promote this goal. While Team Court graduation is a positive step for parents, it does not guarantee reunification with their children. Additionally, information shared in Team Court meetings, such as setbacks, is not confidential from dependency court proceedings, substance use disorder treatment, or the Calaveras County Health and Human Services Agency. I have expressed that I am excited about establishing Team Court and look forward to trying to assist participants in their efforts to achieve a sober future. We had hoped to start meetings during May as part of Drug Court Awareness Month, but accommodating public health needs during the pandemic delayed the start. I want to thank the members of the organizational committee that has established the framework, policies, and procedures for Team Court for their tireless efforts over the past 6 months, specifically Julie Spoljarek, Deputy County Counsel, Laura Larson, Deputy Director, Calaveras County Social Services, David Sackman, Deputy Director, County Behavioral Health Services, Rob Fulgham, County Agency Supervising Substance Use Disorder Counselor, and attorneys who regularly appear in dependency court, Patrick Keene, Jomo Stewart, and David Singer. Thank you. That is our announcement.
Does anyone have any questions they might like to ask the judge or staff on this item?
Certainly. Okay, go right ahead.
I don't think there is any. You were very clear and concise, Judge Saunders. Thank you.
Okay, thank you all for hearing us this morning.
And Mr. Sackman, you can expect a call from me. Diane, are there any other staff announcements?
I don't believe so. If there is anybody else on the meeting that has a staff announcement, could they please use the hand raise feature?
See you across the hall.
Oh, they left quickly.
Okay. Chair.
Okay, thank you. I'd like to move to regular agenda item 1. Madam Clerk, please.
Item 1 for the Board of Supervisors and the City of Angels Camp is from the County Public Health Services to receive an update presentation from staff on COVID-19 novel coronavirus.
This item will be heard by both the Board of Supervisors and the City Council. Mr. Mayor, is there anything you wanted to say before as we proceed?
Let's proceed. Thank you.
Mrs. Stranger, Dr. Kaleda, would you like to proceed, please?
Good morning, Madam Chair and Supervisors. This is Dr. Dean Kaleda, the local health officer. I'd like to give COVID-19 update and begin with a short report regarding the current status of COVID-19 in Calaveras County, and then move into an update of the status of where we're at in the process of applying for a variance with the state of California to allow our county to move further into the allowable business and economic activities under stage 2 of the state's
Dr. Kaleda, excuse me a minute. It sounded a little rough to me. Was that just me, or could all of you, was it clear to you? No. Am I the only one?
It's fine to me.
Oh, okay, I have 2 thumbs down. Any other thumbs down? Can you all hear clearly?
Yes.
1, 2, 3, 4, 4 thumbs down.
So
Ms.
Dr.
Herman?
Kaleda,
4.
if you could turn off your video, that might help. And if that does, and instead of participating with the Zoom.
Okay, so I turned off the video and I'll speak slowly, so hopefully you can hear what I'm saying.
That's because we're politicians. You need to speak slowly.
Okay.
It's still not clear.
So I'll continue talking, Madam Chair, and then let me know if you're not standing, and I'll call in. That's not working.
It's not working. Could you please call in, Dr. Kaleda? Thank you.
Yes.
You know, we should have had a tech services class before we all started doing this a few weeks ago. Diane could be our teacher.
No, Diane could not be your teacher. However, this is not a tech services issue. This is an internet issue that we're experiencing.
There we go.
We can have a long discussion about internet services in this county. Or lack of broadband.
So for anybody that's tuning in right now and is not hearing anything happening, we are experiencing some technical difficulties and we are trying to get that rolling. I believe Dr. Kaleda will be calling in momentarily. We don't see him yet, but I believe he's probably looking for the call-in number.
Did you guys get any rain in the south part of the county last night? Anyone from Angels?
We got some in the east end.
Okay, Dr. Kaleda is on the meeting, Madam Chair.
Thank you.
I have to turn off my my speaker to my computer real quick. Okay, so okay. Can you guys hear me now? Hello, this is Dr. Kaleda.
We hear you, Doctor.
I'll hear you.
Okay, good. All right, so I'll start back at the beginning. I don't know if, but I can be heard now, right? Is that clear?
Yes.
Okay. All right, so I'd like to begin with a short report regarding the current status of COVID-19 in Calaveras County, and then move into the update on the status of where we are in the process of applying for a variance with the state of California to allow our county to move further into the allowable business and economic activities under stage 2 of the state's current pandemic roadmap. So statewide in California, there's 67,939 confirmed cases of COVID-19 with 2,770 deaths. Calaveras remains at 13 cases, all recovered, and no deaths. Hospital capacity remains steady, and Mark Twain Medical Center slowly reinstating elective non-emergent surgeries and preventative inpatient and outpatient services. Testing capability is also continuing to of 1,000 nasal swabs and 800 vials of viral transport media to public health yesterday to shore up our current community testing strength. Our goal is to meet the state's benchmark of 1.5 tests per 1,000 Calaveras residents daily, which will translate into performing PCR testing on approximately 500 Calaveras residents a week. A surveillance program will begin this week to perform PCR tests on all current residents and additional support staff of Avalon Skilled Nursing Facility in San Andreas, looking for potential asymptomatic residents or staff currently infected and initiate prompt isolation to prevent transmission in the facility. This nursing home represents one of our community's greatest vulnerabilities for an outbreak and associated mortality, and so it's a very high priority for us. Contact tracing ability by the local health department is being upgraded with additional staffing and training of contact investigators and the rolling out of a new contact data management and communications software platform to better ramp up and organize local contact tracing efforts and to be able to share this information with neighboring jurisdictions also running the same system, so we'll all be able to communicate with each other. Last Friday, May 8th, the governor amended his statewide stay-at-home order to allow for additional business and economic activities in keeping with beginning to move the state into stage 2 of the 4-stage pandemic roadmap to reopening. As I discussed last week, local counties may attest to variants, allowing for further moving along and deeper into stage 2 than the state as a whole, assuming that the county meets specific readiness criteria that demonstrate evidence-based factors are in place to prevent the reoccurrence of COVID-19 disease. Examples of these specific readiness parameters are satisfactory epidemiology data that demonstrates a low prevalence of disease occurrence, an adequate ability to test and contact trace any exposed persons to initiate isolation and quarantine measures and prevent community transmission, hospital capability to surge their available medical, surgical, and ICU beds, having plans in place to protect the critical infrastructure workforce and to address vulnerable and high-risk populations like the nursing home residents and healthcare workers. At the end of last week, Public Health held a technical assistance conference call with representatives from the California Department of Public Health, and we've prepared our attestation documents for variants. We will require a letter of support from the Calaveras Board of Supervisors, Mark Twain Medical Center, and the County Human Resources Department. Once the state is in receipt of our variance attestation, this document will be available to the public through posting on the state website, and after that, we'll be able to go live. I want to caution this board as well as the public that a requirement for attesting to variance with the state includes a set of specific triggers that would require the reimposition of community mitigation measures in the event of a resurgence of COVID-19 disease occurrence. In other words, if the virus comes roaring back, it may be necessary to restrict certain business activities or social restrictions again in the future. We'll continue to monitor surveillance data for the earliest signs of disease flare-up in order to implement corrective actions before that point. The continuation of the public in performing common sense actions like good hand hygiene, lifting and limiting non-essential trips, staying out of group gatherings, wearing a mask outside, especially those who are considered at high risk, will ensure that we can continue to relax the stay-at-home measures even more into stages 3 and 4 in the coming weeks and months along with the state. Kristen can discuss more of the logistics of the variance process, the differences for the local business community after we attest, what will change, and where we go from here.
Good morning, Kristen Stranger, Health and Human Services. Before I begin, can I just get a thumbs up if I'm hearable? Okay, thank you. Okay, so as Dr. Clada was just mentioning, we have completed our attestation data gathering process, and we are well poised to be able to submit our attestation following the receipt of the Board of Supervisors letter of support, which is an item for the board later on in this meeting. So again, to provide a little bit more detail of what's been done and what in order to submit the attestation, we were able to obtain a letter from the medical center, which is a requirement of the attestation. We are requesting from the Board of Supervisors today, which is also required documentation. The team was able to get all the necessary data to compose the attestation document, and then we were able to receive some backup documentation from Human Resources that will accompany the attestation as well. The next steps will be to combine all of those pieces of data and all of the supporting documentation and submit to the California Department of Public Health. Upon receipt, the California Department of Public Health has notified counties that they will post the attestations to the website that is available to the public, and that counties are not counties are not allowed to move forward further into stage 2 until their individual county plan has been posted to this website. Prior to this meeting, I did verify on the website that no county's plan has been submitted at this time. Multiple counties, including our partners in Tuolumne and in Mariposa, are along the same trajectory that we are in terms of submittal. Counties have been working through the technical assistance calls since Friday and even to yesterday, compiling the data, understanding the requirements, and many counties, such as us, are submitting the attestations as quickly as they possibly can. Currently, just a little bit of information, as Dr. Clada was detailing earlier. Currently, under the state's modified order, does not have a direct connection to the attestation process, but currently under the state's order, the businesses that can operate with modifications include curbside retail, including not limited to bookstores, jewelry stores, toy stores, clothing stores, shoe stores, home and furnishing stores, sporting goods stores, antique stores, music stores, and florists. And those businesses can operate in a curbside and delivery only fashion. This is in addition to supply chains that support the above businesses in manufacturing and logistics sectors. Moving upon posting of the attestation to the CDPH website, the following businesses will have the ability to reopen with modifications, and they include the retail sector, the logistics sector, the manufacturing sector, destination retail, including shopping malls and swap meets, personal services limited to car washes, pet grooming, tanning facilities, and landscape and gardening, office-based businesses where telework remains strongly encouraged, dine-in restaurants, other amenities like bars and gaming areas are not permitted, outdoor museums and open gallery spaces. These are the businesses that compose the remainder of stage 2. And again, upon posting of the attestation from Calaveras County, will have the ability to operate so long as they have the modifications in place as required by the state. We have prepared a press release to let our community know that we intend to release this afternoon if possible, to communicate to them these steps that I'm going through right now. And then also to point them to where they can obtain the guidance about what those modifications are needed in order to reopen. Those modifications can be found. We have a tab on our COVID-19 webpage that says Roadmap to Recovery. It has some localized information and then also a direct link to the state's website. The state's website has many of those businesses already detailed the modifications that they will need to have in order to operate. The governor did let us know that today the remaining sectors that do not have detailed information will be provided on that website today. Upon looking at it this morning, the only sector that I could not see that did not have specifics about what is needed for the state was the dine-in restaurant. That's expected. We've confirmed with the state it will be loaded today. That being said, already best practices, there's already information about how restaurants and such can prepare themselves. What we would ask right now is that businesses that were part of the stage 2 that I just detailed, go ahead and go onto our website if you haven't already, although many have, and begin to familiarize yourself with what the various requirements are. What the requirements will entail per the state is that it will clarify that businesses can go obtain the sector guidance of what they need to have in place. They will be required to perform a detailed risk assessment and implement a site-specific protection plan. They will be required to train employees on how to limit the spread of COVID-19, including how to screen themselves for symptoms and stay at home if they are ill. They will be required to implement individual control measures and screenings, implement disinfecting protocols, and implement physical distance guidance. It's important to note that many of these checklists and details about what entails per industry sector is again available on that COVID-19 website, both from this Calaveras County website and then directly with the California Department of Public Health website. Part of our press release will include a recommendation that the businesses make available their risk assessment and site-specific plan at their place of business, so that if a customer did have the desire to view it, they would have the ability to do so on site. We did want to remind the community that the state stay-at-home order remains intact, but we feel very confident that we are well positioned by the completion of our attestation and pending submittal of it to be able to move Calaveras County further into stage 2 of the reopening process. At this point, Dr. Kaleda and I can take any questions.
Are there any questions from the board or the city council at this moment? Mr. Garamendi.
Thank you very much, Madam Chair, and thank you, Dr. Kaleda and Ms. Stranger, for that report. This is a real victory. I mean, we're moving forward, and it's a great testament to your guys' preparedness. When the governor put forward these rules, in many ways we were prepared to meet the mark. So thank you. Dr. Kaleda mentioned in his comments that there are triggers that can send us backwards. We're moving forward quickly, but we could fall back. It's kind of a tenuous victory. So I was hoping you could explain what those triggers are.
Yes, those triggers are things that we'll be monitoring for in order to ensure that we're not seeing a recurrence of disease. So examples of those triggers are in the category of epidemiology. We'll be looking at an upward trajectory of positive tests as a percent of total tests within the last 14 days. So really we don't want to see more than one case per 10,000 population within a 14-day period, and we don't want to see any more than one COVID-19 related death within a 14-day period. We're monitoring something that's called febrile respiratory illness, FRI. So the medical community is reporting that to us on a daily basis, and we'll be looking for an uptick in febrile respiratory illness, a statistically significant uptick for a prolonged period of time. We'll be looking at clusters of disease transmission that may be occurring. We'll be looking at exposures of individuals connected with mass gatherings, gatherings of other people, that kind of thing. So we want to ensure that the testing capacity is adequate, which is another category of proposed trigger. We need to be testing 1.5 per thousand population test volume daily. So that translates into about 70 tests per day. And so we need to ensure that we continue to test at that volume in order to ensure that we're testing enough people to be really noticing an increase in COVID-19 disease occurrence. In the category of containment, we'll want to see that we're able to elicit contacts for, we cannot elicit contacts for 20% or more cases. That would be bad. 10% or more of non-household symptomatic contacts fail to get tested, those kind of things. So with our containment strategy, when it comes to contact tracing, we have certain benchmarks in place that we need to be able to meet, that we're performing that task adequately. Hospital capacity, the inability to scale up to 30% the number of ICU patients from the current census. If the hospital does not have at least 14 days of personal protective equipment for their healthcare personnel, When it comes to vulnerable populations, if we were to see an outbreak of COVID-19 in the local skilled nursing facility with demonstrated spread to the surrounding community at large, that would be very concerning, and those could be all potential triggers that we're monitoring with data to be able to tell us that these reopening activities are resulting in increasing a reoccurrence of COVID-19 infections in the community.
Thank you. Just one follow-up question. You mentioned that we have to have 500 residents or 70 per day tested. Do we have to have the capacity to do that, or do we actually have to find 70 people a day who want to get tested? And then do we have the personnel available to actually do that? That's a lot. We're small departments. So I don't know, Kristen or Doctor.
We don't want to be testing anybody unnecessarily just to meet a number out there. So we feel that testing volume is adequate to being able to have our finger on the pulse of potential disease recurrence. And so that testing volume can be made up in a lot of different ways. One way is testing the hospital patients, testing anybody that's discharged from the hospital into the nursing home, testing all of the people in the nursing home and all of the staff in the nursing home, moving that into assisted living facilities, which are another high-risk venue. We have plans for surveillance programs to move testing into our assisted living facilities and the staff who work in these facilities. The staff are a very key population to test who work in these facilities because they can be vectors for bringing the illness into those vulnerable populations. So we may want to test those groups even periodically, not just even in a one-time basis, as well as I think what you're envisioning, Supervisor Garamendi, which are members of the public who are interested in testing because they have symptoms or feel like they were exposed to somebody with disease. So all of that together comprises our testing volume, and we feel that that's going to be not only an aspirational number, but a realistic number to be able to let us know that we're monitoring the situation thoroughly.
Okay, let us know if you need help. Thank you.
Appreciate it.
Ms. Matilde, Councilwoman.
Good morning. I was wondering, this letter of intent, how soon will the letter and the supporting letters be able to be sent out? Will that be something that can be today?
This is Kristen. So yes, the intention is to obtain, the last remaining item is the item that's on the agenda for today, which is the Board of Supervisors letter, which is, other counties are also kind of engaging in this same process to obtain that letter. And our intention is to send the package today. And then in terms of notification, because I would imagine the next question you would follow up is how quickly afterwards, we haven't gotten really clear direction yet from the state about when they'll post that information to the website, which would be the ability to then move into actual action. But we will continue to press on making sure that is done quickly. We are amongst many counties who are pressing for that to be done very quickly. So that is pertinent information for your question. I also wanted to make it known that and I forgot to say this in my opening, so apologies, that we will be posting our attestation and documentation to our website upon our submittal so that it is publicly available for the community.
Mr. Stopper. Oh, thanks, sorry. Mr. Stopper.
Thank you, Supervisor Calloway. Something you brought up when you were talking, it may have been real misplaced. You said real estate is later on in stage 2. Did I hear you wrong, Kristen? Because I believe it's part of stage 1.
So I did not cover real estate in this presentation today. There is information about how real estate can currently be operational on the website. It's available. You can get to on our website as well. It's part of the original essential services document that is linked, and it provides specifics about how real estate can be operating in this current environment. In terms of looking at the specifics for stage 2, again, it doesn't it doesn't detail in any more specificity how that can go forward. But that is available currently. I also wanted, Supervisor Stopper, you brought up a good point, so I just wanted to use this as a point to make known to the public. The state has been abundantly clear that if a business is not explicitly detailed in that, those businesses I detailed earlier that are part of the expanded stage 2, it does not mean that the local jurisdictions has the ability to make interpretations, right? So what that means is if we come across a business who it's not abundantly clear, it's part of those entities that I just detailed, the dine-in restaurants with the modifications, et cetera, we do not have the ability to make those local level determinations. We have to write into the state, and if they approve it, it will be posted to the state's website. So that's a point of clarification.
Yeah, I was moving on to the attestation required for the variance also. With that, counties, El Dorado, Amador, and Nevada counties are all saying that they've submitted them. Amador's actually had their health director on the radio yesterday claiming that the state had accepted it already, that they were all working over the weekend. So is that attestation posted or not posted? And to your full knowledge, there are none posted at this time. I just want to make that abundantly clear.
To my knowledge, there are none posted at this time. As of 6 p.m. last night, when we were on another state call, no county indicated that theirs has been posted. Many are having their technical assistance calls, et cetera. But again, to my knowledge, none have been posted at this time.
All right, and so you did say you already made your technical assistance call.
Yes, we did that on Friday.
Which is much appreciated. I do appreciate you being proactive, getting that done. Seems like the next step is the writing of the letter, and then we can see how we will move forward with the state in an expedient fashion.
Yes.
Thank you.
Supervisor Tuffanelli.
Yes, thank you, Kristen, very much for the update and putting the information together that was needed. And Dr. Kaleda, thank you very much for that. My question is, do you have the state website address for the posting of the attestation letter? I don't think you mentioned what that is, and I'd like to at least get it out there so we can look and see from time to time if we've been put on it or anybody's been put on it.
Sure, Supervisor Tuffanelli, I can provide that information. So it's going to be posted to the covid19.ca.gov/roadmap website, which is where we understand it'll be posted. I can tell you we will remain glued to that website, and we request also calls to be notified when ours is posted. And then also you can also link to that website that I just mentioned from our county's COVID-19 webpage. We have a roadmap to recovery tab as well, and it's available there too.
Thank you. Thank you very much.
Councilwoman Herman, did you have some questions or comments?
Well, no, I was going to just say I really appreciate the activity and what is being done and how we've moved along expeditiously. So I think that's very good. And I guess I was only wondering kind of how many tests do we usually do a day? I know in some ways we might be opening the door and we have to, to do more testing. Now we're able to do more. How many have we usually done per day? Are we going to be will the 70 be adding much to it?
Yes, the 70 will be a significant increase in our current test volume. If we go all the way back to the beginning of this pandemic in early March, we've tested between then and today an average of 10 people a day. And our lack of testing has been primarily due to the lack of supplies for collections of these specimens. So we've been able to improve our testing supplies. We've been able to improve access to testing. We have the OptumServe site in Lodi, which is one of the 80 test sites that the state has stood up around California. And so now we feel that increased test volume is going to be more accurately reflecting the potential for disease occurrence. So that's going to be a significant increase in what we've been able to do up to this point.
Okay, thank you.
Are there any other questions from the board or city council? I have some. I'll just go through them, and Mrs. Stranger, Dr. Kaleda, you can pick and choose. If there is an increase in cases, but they are isolated in, let's say, facilities such as Avalon or the jail, and I don't know, are we going to be testing in the jail? Would that impact us, or would we be able to isolate that separate from the rest of the county so it would not mean that we would have to pull back? That's question one. I wasn't clear on the comment on masks. Are masks required, not required? Can a business require them? That was part of our submittal as I was hearing Dr. Kaleda talk. Is there a rumor? I love rumors. Testing, it will be done in Calaveras, so people don't have to go to Lodi, that you were looking for the potential for us to do it in Calaveras. And my last one is the schools. What is the involvement of our public health team with the schools, since they're also an integral part of our county and they're being told they might be able to open? Thank you.
Okay, I'll address some of the questions, Madam Chair, and Kristen, please jump in if you feel you can add anything or if I screw anything up. Triggers for, as I was discussing with Supervisor Garamendi, the triggers for reimposition of community mitigation actions are primarily community-based triggers. So if there was a outbreak of, disease in a specific location or in a specific facility, that wouldn't be enough to trigger community-wide mitigation activities. So when you review the attestation documentation, you can see more specifically what the triggers are for reimposition of some of the community mitigation actions, and you'll see that those are primarily community-based surveillance data that we're collecting. When it comes to masks, masking is recommended on the part of the public in Calaveras County, but not required. Some community health officers and community public health departments have issued mandates for the public to wear masks when outside of their homes. We've not done that in this community. Businesses can elect to have their employees or their customers all wear masks in their facility, and that could be included in their plans that they submit of how they're going to resume their business activities safely. But at this point, I've not mandated wearing masks in public, although that could be something to revisit if necessary. Testing capacity locally, we do have local testing capacity. It's not all just everybody having to go to Lodi. We do have local testing capability for people who meet testing criteria. That can be through their regular medical home, through their regular medical providers, with the MACT clinic, with the Valley Springs Health and Wellness Center in Valley Springs, as well as Mark Twain Medical Center clinics. So people should use their regular medical providers as a first step if they're interested in seeking testing, or their doctors can direct them to testing if they feel that the patient may require it. Schools. We've had requests from schools, and we're reviewing and will approve graduation activities that are drive-through graduation activities for the current school year, so that the graduating students get a graduation experience and yet it still meet the criteria for appropriate social distancing. And we're meeting with the schools and superintendents on an ongoing basis to put preparations into place for schools resuming in the fall. And that is an allowable activity under the later phases of stage 2.
Okay,
So this is Kristen, just to add on, because I just verified looking at the Roadmap to Recovery website. Dr. Kaleda is correct. The facial coverings recommendation is a strongly recommended practice within the business guidance throughout the various sectors. And again, using this as an opportunity to inform businesses that there is industry-specific sector guidance with checklists and such that are currently available on that website, and it will continue to be updated as we progress through this process. We have engaged in a dialogue with the state to discuss if there's the potential of adding an additional testing site here in Calaveras County. None of that is solidified yet. These are in discussion only terms at the moment, but that is something that staff is engaging in. And then lastly, I just wanted to add that the Office of Education has been an integral partner and an integral member of the emergency operations activities through the Emergency Operations Center since the beginning of this pandemic, and have been great partners and working very collaboratively with Dr. Kaleda.
I do have one more question. I am not clear, Mrs. Stranger, on the conditions of dine-in. It's like if this, then that. Could you be a little bit more concise, since I know that's a question the council and the board continually get? Assuming, our variance is in and our variance is posted, then what? What is that?
So, yeah, that's a fantastic question, Supervisor Callaway. Dine-in restaurant guidance is the one of the areas that has not been finalized yet and is not available on the website. So thus far, all dine-in restaurants have seen draft guidance and have been able to prepare in kind of a draft preparation manner. And that's what we've been providing too. The governor did clarify that the industry-specific guidance for dine-in restaurants will be made available on the Roadmap to Recovery website today. And that will be available for dine-in restaurants to prepare. And then the attestations won't be posted until to this website until that information is made available.
So if it's posted today or tomorrow, and then we're posted by the end of the week, does that mean what? Does that mean our restaurants can then be open to dine in?
Yes.
I'm sorry.
No, I apologize for. Yes, as soon as the attestation is posted, and we will make the community immediately aware when that attestation is posted. Restaurants may open for dine-in service so long as they are adhering to those guidelines that will be posted today onto the website.
So is there a way, and talking to people in the restaurant business and having owned one myself, there's a difference in types of restaurants. You have maybe your more fine dining or your smaller restaurants where if it's one person per 125 square feet, you're going to have a restaurant that has 5 employees serving one person versus restaurants that have larger space. Do we have any ability to modify some of the conditions to meet the needs of specific type of restaurants?
So the way the sector is described as part of the state guidance, it says dine-in restaurants, period. That's what it says. There's the brackets, other amenities like bars and gaming are not permitted, which is detailed in the state area. So it's loose in terms of the definition of restaurant.
We're losing you, Kristen.
Oh, darn it. Sorry. You hear me now?
Try it again.
Okay. Apologies. I'm using the internet from the county as well. So dine-in restaurants is how the the sector is described. It does not go into specifics about fine dining versus not fine dining. And the guidance will entail overarching requirements, which dine-in restaurants can utilize to make modifications to adhere to those guidelines. I believe that they will be general enough for the industries, for restaurant owners to be able to make modifications. Again, we have not seen those finalized guidelines yet. We've only been seeing draft format. but those are the guidelines that will be posted to the website today.
Okay, thank you. Mayor Oliveira?
Yes, Kristen, could you expand a little bit on the retail segment? Take an antique store, for example. The phrase curbside delivery, is that to say customers cannot go in the store at all? Or is it and on a little bit?
Sure. That is a great question because it's a little bit confusing. So currently, right now, retail, which all those classifications, the bookstores, the sporting goods stores that I detailed earlier, currently that type of retail can operate with curbside or delivery service. As we into these further into stage 2, retail will also be able to be expanded to in-person in store transactions to occur. So retail was part of the first initial step, and it progresses with additional allowabilities. And retail tab actually already is available on the website. I was just checking just to verify, and there is guidance for how retail operations can ready themselves to be able to expand to the in-person services that we'll be allowed to do as we further in stage 2.
Will that require a further attestation on our part to allow that, or is that natural?
That is part of our attestation. So there's nothing further for us to do.
Okay.
Supervisor Stopper?
Let me know if I'm cutting out.
Or I'll cut you out.
So later today, the governor plans on bringing forward the dine-in restaurants. So we're still at a point where it could be 50% and everything else. Yeah, now it's telling me my internet's unstable.
We can hear you.
Right. Back to Supervisor Callaway's point, some places, depending on the layout and the square footage, they may be pushed to significantly lower amount of customers in there. I think something like that, the supervisors keeping their minds open about other avenues of allowing other tables to open up sidewalk service and sidewalk dining and such might be something that could suffice to address that. Ms. Callaway.
Is there any comments, Mrs. Stranger, you wanted to make on that?
Just to say that when that guidance is final and made available, it's our intention to help make that clear, help the businesses reopen is quick, expeditious, so they can reopen quickly, but then adhere to the guidelines. And again, it's one of those areas where it's a little bit difficult to talk about. It's the one we haven't seen the finalized guidance on yet. I promised it would be there today.
Okay, thank you.
Also, one of the requirements in there is businesses posting and following the rules. It's more so the state will have a set of guidelines, and those businesses must be posting and following those rules. It's not so much the county setting those rules for those businesses on how they can operate through each stage. It's a question. Sorry.
Yes. So as part of the expansion of stage 2, businesses are required to have the businesses that are part of the category that can move forward into stage 2 are required to have a detailed risk assessment and a site-specific action plan. The businesses should maintain those documents on site. So if a customer is requesting that information, it's available. The county is not going to be requesting individual copies of those plans or anything like that. It's more about putting out the guidance that we know our businesses are ready, we know they've been preparing, and that just provided the rest of the remaining tools. We are we feel that they're very well positioned to be able to reopen. There isn't additional bureaucracy in that capacity.
Right. I think it's best for the businesses, so as they move forward, that them holding that document within their possession, so that if anybody questions their actions, they have it on site. That's what the state's requiring. Beyond that, that's their best way for protection of remaining open moving forward.
Yes.
Thank you.
Councilwoman Mafilde?
Good morning. Yes, in regards to, again, the dine-in. So what I've heard is that there will be a detailed explanation on the state website outlining guidelines, and then, but we as a county can't move forward with that until we get the approval from the letter of attestation, or because the state will post the guidelines supposedly today, then restaurants can open as long as they follow those guidelines. I didn't know if there's, is it a two-part, or is it the state said this, this, and this, and go ahead, you meet those requirements?
So the guidelines will be provided for all of the sectors that have the ability to open through stage 2. Those will be available in completion today. As a county, even with those parameters and those guidelines made available, we cannot open up those businesses forward into stage 2 until our attestation is posted to the CDPH website.
Okay, I thought so, but I don't want to assume anything because everybody's chomping at the bit to open.
Yes, and we, in the press release, we've drafted to communicate to the public that our attestation has been submitted, that we will go forward with today. It communicates that in much greater detail because it is confusing. Stage 2 start and then further into stage 2 and can't do this until it is confusing. So we are doing our very best to try to keep that as clear as possible, but you are correct. The guidance will be available today, but those businesses that are part of sector 2 do not have the ability to open until our attestation is posted.
Well, let's hope for the best and get that letter in, and maybe Friday, if the state moves really fast, people be open for business. We'll start getting back to work.
Supervisor Mills?
Yes, good morning. Nice dog, Veronica. I'd like to hear from both Kristen and Dr. Kalita on this county seems to have a real problem in rescinding local states of emergency. As you see on our list for today, we have a number of them. I would like to hear from both of you as to what kind of a timeline are we talking about here to getting through phase 4 and in essence terminating our state of emergency and bringing our county's activity back to what I would consider normal.
Well, Supervisor Mills, last I rescinded the local health officer order for our own stay-at-home requirements for the community, and now we're going along with the state's stay-at-home order primarily. There's only one order that's still in effect, and that's the order that addresses the hotel, motel, recreational lodging issues. But other than that, that's the only local order that's still in effect. The other has been rescinded.
How long do you think it's going to be before we, Calaveras County, gets through all of these requirements, manipulations, whatever you want to call them, to get us out of stage 4 and back to what we were before this all started?
Well, I can't answer that exactly at this point in time, Supervisor Mills. I gave estimates earlier about how the general process I feel would unfold. And the state has a pandemic 4-phase roadmap, which will move us through into stage 3, stage 4, and then finally, reopening all activities in the state, including large mass gatherings, sporting events, concerts, that kind of thing. But my predictions are that won't be happening ultimately to reinstitute all of the events of society to get us back into a normal phase unless there is a vaccine or some other way to ensure adequate immunity of at least 60% of the population. And so that's not going to come at least until near the end of this year.
Kristen, do you agree? Hello? The screen's locked up?
No. A little blurb came on, said my internet's unstable. I don't know what that's saying about us.
I'm still here. Supervisor Mills, I'm still happy to entertain any other specifics you might have on this.
Well, I guess when we get to the attestation, I can expand on it a little bit, but I just wanted to hear from you folks what your timeline was as we move through all of these different phases to get us back to normal. You're thinking more towards the end of this year.
Yeah, I can't answer that question at this point. I can just give you estimates and tell you medically what criteria are going to need to be in place. And to eventually get everything back to the way that we're used to having it in terms of people being able to attend, mass gatherings, that kind of thing. That's not going to be until there is widespread immunity for COVID-19 in the population, and that typically comes in the form of vaccination.
I think it's important to reiterate that we are subject to the state's orders, and the only flexibility that we as locals have been provided is this ability to turn in an attestation and progress through stage 2. That's where it's limited to. We do not have the ability to move stage 3, even with the attestation, which obviously further progresses us. So as county staff, what we're doing is when we have opportunities to be able to progress at a more expeditious manner, we're taking advantage of opportunities as it falls in line with the and specifics to our county.
Okay, I'll leave it at that for now. Thank you.
Mr. Mills, that's a good question, but it probably should go to the governor since we're considered that little subdivision of the state of California. Supervisor Toffanelli.
Yeah, Kristen, that the restaurants that the restaurants
Gary?
once posted or posted, yes. Can you hear me?
No, we're having trouble hearing you, Gary.
Kristen, can you hear me? Hello?
That is better.
Okay. I'm looking for, since if I own a restaurant and I'm dining in after I get through this process, you mentioned that I need to have a plan together. And I may have to post the calendar, but I need to have a plan. My question is, I've never had to have a plan like that before. Is there somewhere we can go and template so we can just fill it out and go make sure we've got everything that's needed? We've got someone to advise our plan, make sure everything's in there that we need to have, and it's organized and well done. When somebody looks at it, either the state comes in or that it's done quickly.
So that the dine-in restaurant industry in the sector's final guidance has not been posted to the state's website. That's what will be posted today. It will come in the form of a checklist. So everything that's out there right now is in a draft format. That is the industry sector that will be posted today at the state's website. I have looked at the other sectors checklists, and it is a process where it's check boxes they've simplified it as much as possible. And so does that answer your question, Supervisor Topanelli?
Well, yeah, I knew that it was going to come forward today this conference and put all that information. I just heard more to go and get a template or use check boxes, go through and that information, and they can go to the COVID-19 website and find that information for dining in restaurants, and then just go down a list, and that's part of the plan. I just want to make sure that they understand what they're doing for this plan. They need to, and I know information will come today, but they use. Do you?
Not a finalized one. There are draft tests available right now, but
Mr. Tofanelli, did you have something else?
No, that was it. Thank you.
Okay. Councilwoman Matilde?
Good morning again. This is Dr. Kaleda. We've heard about herd immunity. Have you, as a doctor, been hearing anything from the state, from testing, any results? Is herd immunity occurring? We have, the information on that because, again, work.
Herd immunity is the concept where there's enough immunized or protected people in a disease around you that if you were susceptible to it, you would be protected by all of these other people around you who are protected from it. We're nowhere near being able to have achieved herd immunity in Calaveras or California or the nation as a whole. My estimates are about 5% of the population has been exposed to COVID-19 infection, and that's probably a little bit generous. It would take about 60% of the population to be able to start to see the benefits of herd immunity. So we're a long way off from enough people having been exposed naturally to COVID-19 infection to have herd immunity start to become a factor to protect us.
Okay, thank you. And then also in regards to antibody testing that has been going on, is there any information on people?
Yes, antibody testing can be helpful. Antibody testing is becoming available now for clinicians to order on patients. Antibody testing will show if a person has previously been exposed to COVID-19 infection, has had it, and now is immune to it through the production of antibodies. We still have a lot of questions about what antibody testing tells us. For example, if a person's been exposed to COVID-19 infection, they develop antibodies on that test. Are they really immune to getting it a second time? We don't totally know right now. And if a person is immune to getting infection again a second time, how long will that immunity last? Those are questions that we haven't had enough experience with antibody testing to be able to know right now. But the potential for antibody testing is very important because if we can identify people who have had previous infection and are indeed immune and protected, those people could be the ones at the forefront of interfacing with other members of the public, with patients in hospitals, working in nursing homes, all of those venues where a lot of our most vulnerable residents might be still being interfaced with.
And in regards to that testing, who is doing that testing? Is it widespread or is it just in studies still? And then also in regards to that, you said that once tested, and then we could determine how long somebody's immune. Do you know that, or in that testing, if you aren't fully immune, if they're looking at a possibility of, okay, you can get reinfected, however, the symptoms are greatly diminished? So I guess that's a two-part question.
So, okay, so the first part, so where and how can people get an antibody test? The primary form of testing is still PCR testing. That's how you diagnose somebody with COVID-19 infection, because you stick a swab in their nose and you look for the actual presence of the virus itself. That's the type of testing that we're talking about when we say testing in general terms, as well as the type of testing that would happen if a person went to the OptumServe site in Lodi. That's all PCR testing. So antibody testing is available at this point. Labs are getting that technology up and running. Certain labs have it right now, certain labs don't. For example, Quest Diagnostics Lab has the ability to start performing antibody tests as early as the end of last week. And other laboratories like the one that Mark Twain Medical Center uses, that's called Healthcare Clinical Labs in Stockton, they'll also have the ability to do antibody testing within probably about the next week. So people can get antibody testing, or will be able to get antibody testing within the next week, I would predict, through their regular medical providers, through their regular medical home. That would be the most effective way for people to seek antibody testing who are interested in it. And then the second part of your question, I think, was a little bit more difficult to answer, because you were asking me some of those things that I don't think we know yet scientifically. Like, for example, how long will immunity last? Will you be able to get the infection a second time if you're re-exposed? And maybe you would get a less serious form of infection the second time, but you would still get sick a little bit. I don't know the answers to that part of your question right now.
Okay, thank you. And the reason I ask that is obviously the flu, we have an actual cold and flu season that comes every year. And the very little I know about COVID-19, it shows that most people are surviving. That, yes, people that are at a higher risk, and then there are always those exceptions that, you know, aren't at a high risk, will pass away. So it's very interesting to see, you know, if this is a virus, are we going to have this reoccurring annually? Because as we all know, we can't shut down the world forever. It's just not, I mean, right now we're all looking at this and thinking, when do we all go under? You know, I hate to be the dark cloud, but financially, our city and our county and our state is in trouble, as the governor just released, you know, what, 54 billion in debt. And, you know, we're looking at a county that depends on tourism, and everything has been canceled that brings in tourism. So, you know, I think that we need to be very realistic, be careful, but also we all have to live. All of us, the majority, has to rule. I know everyone's going to hate me now.
No, I think you bring up a good point. It's a balancing act between the health of our residents and the health of our economy. And I'd like to think that Dr. Kaleda and Public Health are very cognizant of that. And I think you're right. Councilwoman Follendorf, did you have a question or comment? No. Any other questions or, oh, Councilwoman Herman, yes.
Well, what Veronica just mentioned,
I don't know if I'm understanding this right, and maybe Dr. Kaleda can tell me. When I've looked at the statistics and seen like 24,000 to 60-something thousand flu kill people every year, but we don't do a lot of mitigation. We do have a vaccine. Now, when we look at this virus, it's, as we see, climbing beyond that, and yet we've done a lot of mitigation. So is that a confirmation that it is truly more contagious than the flu?
The COVID-19 virus is highly contagious. I don't know that it's more contagious than seasonal flu, but it is highly contagious. We've had multiple examples of individuals getting infected from relatively short, intervals of exposure to other sick people. The case fatality rate is 10 times higher for COVID-19 than seasonal flu. So when people say, well, most people who get COVID-19 infection won't die from it, that's true. In fact, 80% of people with COVID-19 infection will develop relatively minor symptoms or even be asymptomatic. But those 15 to 20% of people who do get more serious complications, including hospitalization, requiring a mechanical ventilator to assist them in breathing, or even death, are significantly higher than those with seasonal flu. And when we typically see rates of seasonal flu deaths annually in the United States at anywhere between 20 to, in some bad seasons, 60,000, that's over an entire flu season. I'd like to remind everybody that the deaths that we've seen in the United States, greater than 80,000, approaching 90,000, have happened in a very short period of time, in a 2-month period of time. And so the COVID-19 infection is significantly more deadly than seasonal flu. And I don't think that's a good comparison for our preparation and mitigation activities.
Yes, that's what I was thinking. As I thought about it, I can see that there is more of a danger. And I think that our society is kind of confused and uncertain about whether or not that is true. But in the studies I've done, it appears to be, yes, that we do have a greater threat from that. And therefore, the things that we are taking, the precautions and mitigation, have some good sense to them.
Councilwoman Herman, is there anything else?
No, that's all.
Okay, thank you. Councilwoman Matilde?
Hi, again, for Dr. Kalea. Recently in the news, doctors were reporting information about the virus dying very quickly, being exposed to UV light. And I'm wondering, have you heard anything in regards to people being not that they are out in the sunshine and that the light can hit inside their body and magically kill the virus? We know of patients being positive and doing better during a better time of the year in regards to sunshine, fresh air, etc. I know a lot of the numbers come out of New York City, and as much as I like New York City to visit, it's cold weather, they're packed together, they don't get a whole bunch of sunshine all the time. They have been in their winter. So is there any information in regard to, again, exposure of sunshine and fresh air helping in regards to symptoms?
COVID-19 is a respiratory infection. It lives within the cells that line the airways, like your nasal passages and your lungs, and it can be transmitted to another person through the small droplets that are produced with coughing and sneezing, and then it gets into another person's airways and their nasal mucosa, and they acquire the infection. So certain conditions can make that more likely, certain conditions can make that less likely. The closer people are together for longer periods of time, that increases the potential for disease transmission. If people are outside, if they are in in a well-ventilated area like an outdoor park, and they are 6 feet away from each other or more, that significantly decreases the potential for person-to-person transmission. So there's nothing magic about UV light or other environmental factors. There's just the conditions of separating people, being in well-ventilated areas such as outdoor spaces, and hand hygiene, hand washing activities are the things that will reduce the potential for disease transmission.
Councilwoman Follendorf.
Hi, yes, I just have a comment, and I just want to say thank you for everyone for allowing us to continue to be on these meetings. And I just think as elected, it's important to remember that we continue to be proactive in educating the public, mitigation measures. So not only are we protecting the public health, but also to start supporting our local businesses and economic recovery. So I just wanted to chime in and say thank you, and we appreciate it.
Are there any other questions or comments from the council or the board? Ms. Harmon? Yes, please.
Oh, just to kind of show, because I've been very proactive in getting businesses and wanting to see us reopen, and then I also said that I can see the contagiousness, and I'm really combining those two because our county, I'm trying to visualize the economic balancing with the sickness. And I think that's our common sense. And then we as representatives have a responsibility to find that balance. So I see in our county, we've not had a lot of cases, and therefore I'm proactive in us coming back. But yet again, I think we should do it carefully and make sure we follow the mitigations. At the same time, I really encourage our reopening as soon as we can.
I'll just take it as the final question. Mrs. Stranger, if businesses need clarification or have questions on what might be required of them, is there a number that they could call to get those answers besides calling their elected boards and city council members?
Yes, thank you, Supervisor Callaway. That's a great question to ask. So this information is available on our Calaveras County COVID-19 website. There's a Road to Recovery tab where businesses can gain information. Businesses tab on that webpage, there's a plethora of information on that webpage. Also, the community call centers is another venue that businesses can get the questions answered. And that line is, I have it right here, 209-754-2896.
28 what? The last two digits?
Our community call center says line is 209-754-2896, Monday through Friday, 8:30 to 4 p.m.
Great. Thank you very much. Madam Clerk, are there any emails or phone calls coming in, please?
Yes, ma'am, there are. So the first email comment is from Noreen Coca. She says, we own a small business in the county for 20 years. We are begging to have businesses reopen. There are large stores in Modesto that have been deemed essential and are currently open. We are losing revenue and are fearful we will not be able to survive. The next is from Jacqueline Youngquist. As business owners, that provide holistic services such as massage therapy in Copperopolis, California. I am eager as many fellow businesses to open up safely. We need guidance and timeliness and support to get back to work, providing for our communities and families. The next is from Ashley Skeen, the president of the Calaveras County Republican Party. We write this letter to ask the board to reopen Calaveras County for business. We firmly believe that business owners should not be denied their constitutional rights to conduct free commerce and make a living. Likewise, we believe that the citizens of Calaveras should be able to make their own decisions concerning their own personal safety. It is inappropriate for the government to decide if a person is safe to shop at a chain grocery store, but is not allowed to rent a motorboat or eat in a restaurant dining room or visit a hair salon. Those are decisions that should be left to the individual to make. This is the American way, and it is what has set our nation apart from the rest of the world and has kept us a free society. We are seeing disturbing unconstitutional orders being posed by Governor Newsom that are neither lawful nor right. If left undisputed and unchecked, numerous precedents will be set, and an erosion of our democracy will occur, which will not be able to be reversed. It is our understanding that a lawsuit may be impending against the county in the near future. We do not wish to see this happen. We ask that the board move to join the other rural counties in California and the nation who are taking a stand for liberty, justice, and the rule of law. The people have elected you to be their voices, their policymakers, and their representatives. We ask you to listen to them. We have several public callers on the line right now, but first I'd like to ask if the City of Angels had received any written comments.
No, we have not.
Thank you. Okay, so the first caller whose phone number ends in 8700, you are live with the Board of Supervisors and City Council. You may begin your comments now.
Hi, can you hear me?
Yes.
Hi, this is Sissy Hedrick, owner of Sissy's Bella Salon in Murphys, California. I have been in business in this community since 1994. It is my livelihood, and I would like to be back at work. I have a question for you. I want to know, how was Dr. Kaleda chosen in his position? I want to know, how long has he been contracted, and what was his beginning date? And has anyone else been considered the opportunity to be the county public health officer? That's my question for Dr. Kaleda's position. I have a question for our local supervisors. For me, it's Marita. For other areas in the community, for salon owners, you know who you are. We have a letter that we sent last week. The whole thing was not read entirety because of the amount of words, but we had 238 names, on that letter. Are you guys, as our supervisors, fighting because we live in a small community to allow us to do our jobs, which are already under stringent rules of sanitation? And we have given you an outline of how we can even be more prepared to keep our clients who feel safe to come in. And are we more concerned about getting to go to big box stores than we are about letting our community come in and get the services they need? Many of our clients do not have the ability to do their own hair, their own nails, their own feet. This is a very hard thing for many people in the community, not to mention us that are small business owners, that this is our only source of income. I have not received financial aid in any way, shape, or form as of this moment, except for by friends and family who stepped up and helped me out with some bills. Thank you for listening, and I hope you can answer these questions for me.
Thank you. Caller ending in 6907. You may begin your comments to the Board of Supervisors and City of Angels now.
Hi, thank you for taking my call. My name is Chelsea Frazier, and I am sorry. This is a lot, and this is destroying our community. And it is, Dr. Coletta said that things might not open until the end of the year, and we will not make it till the end of the year. You need to listen. We are begging you to listen to your community and open. We are a small community. We are grown-ups, and we can decide what is healthy for us. As far as herd immunity goes, the longer we are in our homes, the longer we are suppressed, or we are going to have an outbreak. And there is a huge percent of our community willing to take the first step of going out and taking that risk and becoming immune in helping in this herd immunity without a vaccine. We are begging you to hear our cries. You were chosen by us, so please hear our cries and open the county. Thank you.
Thank you. Caller ending in 1491. You may begin your public comment now.
Gala.
Go ahead.
Thank you for allowing my comments. My name is Al Sagala, and one of the concerns I have is, besides winning this battle with the virus, is protecting our country so our children can inherit a free society from us. Present direction doesn't seem to be good for that. One question, important question would be, are the pronouncements by the governor actual orders that need to be obeyed, or suggestions subject to local discretion? I think constitutionally the latter is the truth. The Constitution does not allow for the establishment of a dictatorship without a constitutional amendment. That means that the court, legislature, or executive, in attempting to establish a dictatorship, are in violation of the Constitution. Most of the information promoted by WHO, that's the UN, and the U.S. government regarding projections of high infection rates has been proven false and inflammatory. Even the percentage of deaths as a percentage of those who contract the disease has been way off. It's less than 1% according to recent studies. Antiviral masks should be promoted with a 6-inch space no longer needed. Antiviral masks are masks that have the ability to kill the virus. They protect two ways. This is being almost totally ignored. We have highly vulnerable people, older people, older than me, and maybe me too, that need to have blood tests and are to determine the levels of our immune systems. Levels of vitamins D, C, zinc, and CoQ10 seem to be important for a healthy immune system. We need to make sure that the vulnerable people have their immune systems strong. And this doesn't need for a government order, because people that should be concerned about this will be suggesting it. And also, pre-existing condition deaths are included in the virus tests. If the person is dying from cancer or some other thing and also has the virus, does the virus count as the reason for that death, or the real cause of the death, which is what their pre-existing condition was? Thank you very much.
Thank you. Caller ending with their phone number ending in 0670. You are live to make your comments now. caller with the phone number ending in 0.
Can you hear me now?
Yes, we can.
Oh, good. Just had it on mute so we wouldn't have feedback. Well, good morning, board. This is LaVon Miller from Mountain Ranch, California, and want to thank everyone for their efforts on trying to protect our community from COVID. Have two subjects to cover today, quickly COVID and then the cannabis program. First on COVID, I would like to caution you for progression of standard of care for our community to kind of resemble that of a broken bone. We had a bone break and we weren't able to actually take an x-ray of it and see how extensive the damage was to our community. And we went ahead and put on a splint or a cast or what have you. We suppose because time has passed that fracture may have healed some, but we're not sure because our x-ray machine is still down and we don't have surveillance and testing to know where we are with that care. So now we're just going to take the splint off. We're going to let the community hobble around for a little while and see if the break reoccurs and we have to really splint it. So I would suggest that you begin to look at the big picture of standard of care. I, for one, as a high-risk individual with a suspected immunity issue, my doctors advised me to stay isolated. I'm not going to feel comfortable going back to work in retail until we actually have true community surveillance. Per your own issue or own things that you spoke about today, that doing 70 tests per day is still focusing on those who are admitted to the hospital, not the community at large. Okay, to the issue of the cannabis program. Congratulations, Calaveras County. Board of Supervisors, thank you so much for making this possible for us. And I have to say that county staff has been outstanding with fits and starts and trying to get the program perfect, but everyone is giving 110%. And I'm happy to say that we are fully compliant and have had our state provisional licenses issued. But now the only thing pending with county is the badges. We're completely done with everything else. As soon as we have a badge, we can put plants in the ground. That needs to happen now. It's May. It's spring. We're farmers. We need to do this. We already have live scans verified. You guys know that we're not criminals and that we're in this for the long haul. We won't have a viable product until fall anyway. So rather than letting the badge machine issue hold us up, let's see, I'll bring my laminator down and set you up with cardstock and some film and let's print something temporary. So I think this is great that this is the only stumbling thing at the very end of this whole process. So let's come up with a creative solution. The board created badges. Let's create a creative solution to hold us over for a month or two while our crop isn't even viable anyway.
Miss Miller,
Is my 3 minutes up?
No, that's not on the item that we're discussing right now. And there's
I'm sorry. I thought we were doing general public comment. Is this not for general public comment?
It is not, as COVID related due to.
Oh, I'm sorry. I thought we usually held public comment before agenda items. I've been on since 9 a.m.
No, not in this case.
Not in this case.
Okay.
We're in a unique situation.
Well, I greatly appreciate you hearing me out regardless, and have a wonderful day. Thank you for your COVID efforts. Bye-bye.
Madam Chair, it looks like there are no other callers.
Okay, thank you. I want to bring it back to some of the comments that Ms. Hendricks brought up, and I'll try and address them. I'm more than happy if a staff member would like to sit in. But under the government code, the governor's orders shall have the weight of law. So when he says that we're stay at home, that's the order. If he said that we can now go into stage 2, given these are conditions, that is the order. The health and I know it sounds bureaucratic, Sissy, I'm really sorry, but there's prices that counties will pay if we don't sort of follow what the law is. And under the health and safety code, the public health officer is required to take whatever measures are necessary to prevent the disease. The Board of Supervisors has no statutory authority to overturn what the public health officer says. We can give recommendations. We can ask him or her to consider it, but all the public health officers in the state of California have to abide by that. Are there some counties or public health officers that are not? That's possible. And if we listen to what the news is, some of them are paying the price in that the obvious one, of course, might be the ABC going in and pulling liquor licenses. The Cosmetology Licensing Board can go in and pull the licenses of nail salons or hair salons and guarantee I want to go back to one. So I understand the frustration you have. The letter that you wrote and that was signed by a lot of your colleagues was an outstanding letter. We understand that. But we have taken it on ourselves as a county to say we're a subdivision of the state and we are going to follow the orders that the governor issues. It's in the best interest of the county and it's in the best interest of our businesses. We do not want the state coming in and coming into our businesses. The county has taken generally a very soft approach when we've had businesses that are not abiding by what the rules are. We have gone in to talk to them. We are not pulling building permits. We are not calling licensing boards in the state and having them come in and talk to a salon or a bar or a restaurant, whatever it might be. I know it's frustrating. I know it's painful. And the board, the city council are very well aware of that. I mean, I spent Friday, Saturday, Sunday, and yesterday walking the streets. I was, of course, in our district, which is Murphy's and Arnold, talking to business owners. And I understand the pain you're going through, which is why we have pushed the health officer, Dr. Kaleda, and public health to get our variance application to do our attestation into the state. We cannot go into stage 3 without permission from the state to say we can go into stage 3. I wish I had better answers for you and for your colleagues, but at the moment that's been pretty much the position of the board and why we're following the orders from the governor. Mr. Segala, you're talking about things that are way over my head. I cannot go into antiviral masks or anything, but we do miss you at board, so I'm glad that you've called in. And to all of you out there, I can truly, from the bottom of my heart, tell you that this board and this city council are very cognizant of your concerns. And more than anything, we would like to get business back, and we would also like to protect the health of our community. That's all. If anybody else has anything to say, I'll give you 30 seconds.
Madam Chair, we have someone on the call named Douglas who has raised his hand. I'm not sure if he is trying to make public comment or exactly what that is.
I don't see a hand raised, so thank you. Go ahead. I see Douglas.
Are you making public comment, Douglas?
I'm commenting directly on the COVID thing, yes.
Okay. Go ahead.
Okay, this is actually Doug Oliver, your chief building official, and I want to preface this by saying that I work here and therefore I write for the brand. Whatever you guys direct me to do as a department head, I'm going to do, but because I also gave an oath to defend the Constitution of both the state and the United States, against all enemies, foreign and domestic, I felt I needed to at least share my insight on what's going on and maybe give a constructive way to hopefully resolve it. Looking at the government code, the California government code section for the powers of the governor under the Emergency Services Act, there's a list of things that he is empowered to do. Most of it is suspending laws that hinder the ability to provide services. Also, be able to mobilize food, necessities, medicines, equipment. In some cases, he can commandeer land or commandeer people, but that is to help. I don't see anything in his powers that quarantine healthy people. This is in section 8570 of the government code. Also in California Health and Safety Code 101040 and 101475. I believe that's the correct one. Both of those are the powers of a health officer. They are empowered to do a lot of things to abate a nuisance. I don't see anything expressly implied about quarantining healthy people. That being said, I agree with our county council that we cannot go against a governor's order. It's very clear, and there's case law to say that yes, if you go against it, you are you're committing an act that is enforceable. However, we can question the constitutionality of it, and we can also, constructively, mind you, we can say that he is required to suspend a state emergency as soon as there isn't a state emergency, and we may be able to make findings to say that it's no longer a state emergency because of the cases and the ability to mobilize necessities within each county, that maybe we could petition the governor to go to a local emergency in those areas that need it, and for the communities that have their act together, like what our good public health has done in the last couple of months, we could demonstrate that we don't need it, and perhaps the governor can reduce it from a statewide to a local emergency for those cities and counties specifically. There's my 2 cents. I mean, I agree with a lot of people out there. They need to get back to life. And
Your 3 minutes is up, Doug.
Okay. If there's no other further comment from the board of the city council, we're going to be adjourning this part. Mayor Oliveira. Mayor.
You're muted.
Yeah, I was trying to unmute, pushing the wrong button, I think. I think we just need a motion on the part of the council at this juncture to adjourn. We have a movement. Amanda, second.
I'll second.
Linda, seconds. All in favor?
Aye.
Aye.
Opposed? Carries 5-0. City council is adjourned from the meeting. Thank you.
Thank you, Mayor.
Thank you very much.
Would you all like to take a 5-minute recess? Or
Yes.
then we'll move to the next item.
Madam Chair, what time will we reconvene?
Oh, I don't have a watch. You give me a time, because
It's 11:03 right now.
10.
11:10.
11:10. Okay, thank you. Okay.
All right, I'd like to reconvene the meeting, please, and move to item 2 under regular agenda 1. Madam Clerk.
Item 2 is from the Administrative Office to authorize the board chair to draft a letter of support on behalf of the Board of Supervisors to accompany local public health officers' written attestation to the California Department of Public Health for a local variance to increase the pace at which Calaveras County advances through stage 2 of California's roadmap to modify the stay-at-home order.
Thank you. As you know, part of the requirements for the attestation to the state is a letter of support from the Board of Supervisors. And we would, of course, like to get that out today, but I can't do that until I have the support of the board, or at least from 3 of you. And so I'd like your thoughts on what you think should be in the letter. My opinion is always it should be short and concise, to the point. Supervisor Stopper.
Thank you, Chair Callaway. Something was brought up earlier about 8570. That emergency declaration legislation was written in 1970. Some of those thoughts were some things I had jotted down here, but with our letter, to the point of the letter going to the governor, I do agree with you. Something short and sweet and to the point, will facilitate things. But also, there's a few other things I believe need to be said in it that I just would like to be heard, for consideration as the board moves forward. Every county has a unique set of circumstances across the state, and one size fits all does not work when it comes to addressing the COVID-19 issue. Calaveras has had 13 cases in the last 2 months, with none currently active and 0 deaths. We are a rural county, naturally socially distanced to a certain capacity. We do not endure the issues of urban areas. We respectfully ask the governor to rescind the state order of emergency and give control back to the counties in accordance with state law. It is not a loss of life we are currently dealing with in Calaveras County, but rather a loss of livelihoods. Governor Newsom, as you have stated, some areas are able to move forward faster than others. We are the best judge of our needs and ways to address issues in our unique Calaveras County. We respectfully ask that you accept our attestation in support of a variance to move forward through the phases expeditiously. We also request consideration of our unique situation, along with all of our brother and sister counties across California, and give us local control.
Thank you. Any other comments from my colleagues? Ben, not that some of your concerns aren't, but if you're wanting the governor to rescind the state order, to me that should be a separate item, not supporting the attestation of the public health officer, because really what we're saying is we support what they're submitting. And the conversation, a few other things put into it. But, they know we were old, they know, how many cases. But the key to what you were saying is you wanted the governor to rescind the state order. That's a separate issue than what I believe is before us today. So if you would like to bring that up at another meeting to see if there's support to write a letter to the effect. I don't know. I'm throwing that out. Any thoughts on behalf of Mr. Mills, Mr. Tuffanelli, Mr. Garamendi? Mr. Tuffanelli.
I support Ben in what he's saying. I don't think we'd be the only county that's done that, a rural county that sent a letter with that verbiage in it. He is again supporting what our public health is doing in our assertion letter, but he's also requesting that the governor give back, at least to the rural counties, control to us. We're the best judgment of what's going on in our county. Again, one size does not fit all. I totally agree with him. We're not a big urban area. We're not hardly hit. We haven't had a case in the last 3 weeks. We have no deaths. I support Ben.
I mean, I hear what you're saying, but that's what this whole variance process is about, for us to move forward. is we're getting a variance with the attestation, but we're not asking him to rescind the order. I think that's a separate issue. I think, you know, the message will get.
I support.
I'm sorry. Go ahead, Gary.
I don't think our message will get lost. The verbiage in it says we support the assertion letter. It specifically states.
No. That I agree. That's the whole purpose of what we're doing. We support what Dr. Kaleda is attesting to, and that's the letter that's required. That's required for him to move forward. Mr. Garamendi?
Madam Chair, I believe Mr. Mills was ahead of me.
Mr. Mills?
Thank you. I appreciate the thought. I fully support what Mr. Sopper is saying here. If that verbiage is not in our letter, I won't be able to support it. It is very important to read what California Department of Public Health said on the May 7th letter, which said that it's not required but recommended that input from a broad range of county stakeholders, including the County Board of Supervisors. At this point in time, 2 months in, this board has never had a substantive discussion on our opinion on how to move this thing along. It's all been strictly just receive a presentation. I think it's time for us to sit down and have an agenda item and discuss that separately. There are 208 cases in 19 counties in rural California. If you liken this to OES and fire, you know, we don't lock down a whole state because there's a fire in Santa Barbara County. And that's basically where you send the resources where the resources are needed, rather than keeping everybody home on the farm. We've locked down 4 counties that had no cases, no fatalities in this state, and yet they're required to fit within these same rules. And I fully understand what's being done here but the governor has repeatedly said he wants to see some local control. He wants to see some local responsibility for what we're to be doing. I listened to the 12 hours of the Riverside supervisors meetings and their discussion on this whole issue over this last week. I think it's very important that we hear our citizens and listen to what they're saying regarding what's going on. Yuba City has said this isn't going to affect them financially as much as the state would like it to. And if we're sitting here thinking that we're hoping that the state is going to somehow be able to fully fund all of the plans that they need to make between now and the end of the year, knowing the $54 billion shortfall, that's simply the idea of give me a hamburger today and I'll pay you on Tuesday. It's not going to work. So I want to be sure that we, the board, or I, as a voting member of this board, is able to see what is going to be in this letter before I make any kind of a vote to approve it. And it has to include what Ben has said.
Mr. Garamendi?
Thank you, Madam Chair. Mr. Stopper, can I ask you to reread what you said so I'm clear?
Absolutely, sir. I think I work towards respectful to the state because of some of the issues some of our brothers and sister counties are dealing with to the north of us. And I didn't want to put us in that situation, so here it is. Every county has a unique set of circumstances across the state. One size fits all does not work when it comes to addressing the COVID-19 issue. Calaveras has had 13 cases in the last 2 months with none currently active and 0 deaths. We are a rural county, naturally socially distanced to a certain capacity. We do not endure the issues of urban areas. We respectfully ask the governor to rescind the state order of emergency and give the control back to the counties in accordance with the state law. It is not a loss of life we are currently dealing with in Calaveras County, but rather a loss of livelihoods. Governor Newsom, as you have stated, some areas are able to move forward faster than others. We are the best judge of our needs and ways to address issues in our unique Calaveras County. We respectfully ask that you accept our attestation in support of a variance to move forward through the phases expeditiously. We also request consideration of our unique situation along with all of our brother and sister counties across California and give us local control.
Thank you very much again. I mean, I'm not, here's what I think. I think that I agree with Madam Chair that we need to keep this simple. And I don't think the stuff you're adding adds much length to it. You're talking about half dozen sentences if I was counting off the top of my head. The only issue would be the term rescind the state of emergency. I think we ought to ask him to consider the state of emergency. We have no authority for tell the governor to rescind anything. And so we should just ask him to consider it. Certainly we want more control, but we are still a subdivision of the state of California. So with that one word, I could get along with what you said. And then maybe there's just a different way to say it.
Yeah, no, and I'm open to suggestions. I'm here to work with my colleagues. And I do hear what you're saying. And personally, I could definitely support a change in what I'm doing. And I would look to my fellow supervisors to see if they would be fine with it also.
Yeah, I mean, I'm on board. I know we have to have public comment on this item and everything, but I think using the general concept that you outlined with the principles put forward by the chair to keep it short and simple. I mean, this is just we're throwing in a little politics and basically a transmittal letter, and that's okay. We can do that. But we just need to get this thing done. And, I don't think the governor's going to read the whole letter in any case. So I don't see any reason not to say throw a little politics in it.
Well, that's unfortunate.
He's got a lot on his plate. Madam Chair, that's my only point.
We all do.
I mean, my feeling is we need to say right away what it is this letter's about. This letter is about the support of the attestation of our public health officer. That wasn't said. It took a long time to get to it. And then we need to say, I think somewhat has been said, we're in a strong position to move into stage 2. That's what we're trying to go for, to go back to what it is. The application, as I'm assuming most of you have read, all that information is in the application. They know we're rural. They'll know how many cases we've had, how many deaths we've had. They know all the stats. There's in there about that we are going to continue to monitor the program, and we just support it so we can move into stage 2. The only person that's going to read it is some analyst who's sitting at a desk, and so it can just get posted. The keys of what Ben is talking about belong to me in a separate letter, because whether we ask the state or to consider the state to rescind, that's not what the purpose of this letter is. This is just to say we support the public health officer's attestation to this application. Here, that's what it's all about. And so for me, it's keeping it really concise and to the point, and you say it in the first paragraph, and we maybe throw a little bit in the middle, and then you end it with, we support this application. I mean, that's how I see it. But the other things Ben's talking about, to me, are appropriate in a separate letter. And as Mr. Mills said, maybe we need to discuss that. We need to discuss that we want the governor to consider rescinding the state orders. Jack, that was similar to the letter, what we wrote for the funding for under 500,000. We were short, to the point, exactly what it is we're asking for. So if you put in a lot of stuff, it gets lost in the message, and for me, it gets lost to what's the objective and the requirement for Dr. Kaleda to attest to this and make the submittal today.
I'm hearing what you're saying. I mean, I think you have a very good point that I did wait till close to the end of the letter. So, you know, the point of the letter is lost in it. I mean, that paragraph, short and sweet, could be moved right up to the front along with the rest of the message.
So you want
to move it right?
In the letter? I'm sorry, Gary.
And we could move that sentence right up to the front part of it and then start the second part. As far as the word rescind, we can come up with a different word from rescind. But Ben and I have talked about this for a week now, about getting to this point here. And the rescind is a word. We can come up with a different word if we're going to get on board with it. But I disagree with you, Marita. I think this needs to be part of this letter.
But it's just the governor is not going to see this letter. You know, this is a letter to just say we support the attestation of the public health officer. That's a requirement. It doesn't,
we can send it to okay. We can send it directly. We can send it to where we need to send it, and we can also send a copy directly to the governor.
So I was going to remind, the letter that is in support of the attestation that's required for us to be able to move faster does go to CDPH to accompany the attestation. Of course, you could, as Supervisor Topanelli just said, you could send a copy to the governor or whomever else you wanted. I'm trying to take notes as you're all talking. And again, this is kind of what I'm getting, or this is a thought of, up front, first sentence is the Board of Supervisors supports the attestation so that we can move faster. And I'm trying to, Supervisor Stopper, if I didn't take good notes, please correct me. But just making the point that every county has a different set of circumstances that's unique. One size does not fit all. We're rural. We've only had, sorry.
If I may, real quick, not being rude, but I could hand this over to Al in the office next door, and he could type it up in Word real quick, so then we could all view it real fast. It's not very long at all. I mean, it's written out. So here's the CAO. Here's the first.
Mr. Garamendi.
Madam Chair, going along the lines that Mr. Stopper suggested, maybe we could move through this item, have our public comment, get a draft of this, keep it as simple as possible, still checking those boxes. And then, my preference would be, hey, we've given direction to convey this, let the chair do this, get it off the table. But if we want to bring this all together, we could just type it up real quick and then table the item till the letter's ready, bring it back later on in this meeting. The clock's ticking, and I know that public health would like to get this out the door. So it should only take 15 minutes. We can move through the public comment and see if we can.
Except that I have thoughts on the letter that are different than Ben's. So do I put my letter together and say, okay, board, and maybe Gary has, you have one? I mean, we've got to do it. We have to do it now. And I disagree with what Ben wants to put in the letter. I think it gets off target, that if we want to do another letter, then I think, we could do it. I just am such a believer in who's the audience? I'm sorry. Go ahead, Gary.
Marita, it's not only Ben that wants to put it, it's not only Ben that wants to put it in the letter. It's not only Ben. And I think we have 3 votes. Why don't we go to public comment like Jack said, and then Al can type it up and we can post it up and look at it.
Mr. Mills?
Yeah, I think anything we do going to the state right now has to be an opportunity for us to clearly define what our role is going to be, what our responsibilities are going to be, and where we stand on it. So I'm hoping that everybody will understand the importance of every moment in time that we do interact with our counterparts at the state should be an opportunity for us to be heard as to how we want this to work for us. And that's the primary thing that I'm seeing with Supervisor Stopper's letter.
Well, maybe I'll do my own letter and show it to you. Mr. Garamendi?
I'm sorry, ma'am. My hand should have been lowered.
Okay, so we'll, why don't we come back to this item?
Public comment.
Okay, yes. Madam Clerk, is there any public comment on this?
No, there is not, Madam Chair.
Okay, thank you. Let's postpone and we'll come back to this item. I'd like to move to item 3.
All right.
Madam Clerk, did you want to, we have recognitions and acknowledgements.
Yes, ma'am. Item 3 is from Behavioral Health Services Mental Health Program to adopt a proclamation recognizing May as Mental Health Awareness Month in Calaveras County.
Is there any staff comments on this?
Yes. Hi, good morning. Can you guys hear me?
Yes.
Hi, good morning, Chair members and Board of Supervisors. My name is KB Alvarado, and I am the MHSA Support Services Supervisor of Calaveras County Behavioral Health Service Division. I want to say thank you for giving me the opportunity to speak about May Mental Health Matters. Usually this month has been very active with outreach, engagement, and training efforts in order to spread awareness about mental health. Even though we are unable to get together in a group setting to show our support for mental health awareness, we are establishing efforts in many other ways, such as displaying the Mental Health Awareness banner at the Living Room Peer Center, providing peer support warm line, and encouraging everybody, including the community, family members, and clients, to attend the NAMI virtual walks. That's happening on Saturday, May 30th. More information you guys can go on to www.namiwalks.org. In addition, we are sending out each Mind Matters materials, including the lime green ribbons, which I will go to the community and pass out after this. Also, community resource calendars and giveaway items are being offered to community partners to distribute. To conclude, every day, millions of people face stigma related to mental illness, causing many to face their mental health challenges for years without help. Each May, Mental Health Matters Month provides the opportunity for everyone to come together to raise awareness in an effort to stop the stigma. Bringing forth this awareness is crucial to helping people reach out for the assistance they deserve. And we are proud to announce that one of our peer specialists shared his story of hope as a reminder to all that everyone can recover from mental health and live fulfilling lives. His story can be viewed in the agency internal newsletter. If anyone is interested in that, I can send that out to you. He also wanted to share a quote. It states, "We don't heal in isolation, but in community." Thank you for your time.
Thank you, Ms. Alvarado. Mr. Garamendi, would you like to do the proclamation, please?
I will. Madam Chair, you suggested that just as a matter of expediency, I carry this through the vote?
Yes.
Okay, thank you. Want to make sure that was still the case. Yeah, this is my 4th year serving on the Mental Health Advisory Committee for the county, and I have to tell you, we have some wonderful people working in mental health, both as clients as well as professional staff, and it's been a real honor to be part of it. So it's my honor to do this proclamation as well.
Thank you, sir.
Excuse me. Proclamation. So this is a proclamation declaring May as Mental Health Awareness Month. Whereas Mental Health Awareness Month is part of a nationwide effort in the month of May to reduce the stigma and discrimination surrounding mental health challenges, increase awareness of tools and resources to prevent mental health challenges, and reduce the symptoms. And whereas prevention in the form of a healthy diet, exercise, sleep, and stress management good for all of us, is an effective way to reduce the burden of mental health challenges and can help all of us protect our health and well-being. And whereas learning the symptoms of mental illness and early identification and treatment can make a difference in successful management of mental illness and recovery. And whereas many may experience symptoms of mental illness associated with the rising number of COVID-19 cases, changes to routine, and loneliness from isolation, it is important to remember to use coping tools such as staying connected with family and friends, doing things at home that you enjoy, practicing healthy stress relief, and whereas every citizen and community can make a difference in helping end the silence, change the negative attitudes, and end the stigma that for too long has surrounded mental illness. Whereas the Health and Human Services Agency Behavioral Health Services has opened a warm line to support mental health needs in this community. The warm line can be reached at Monday through Friday from 8 a.m. to 5 p.m. at 209-754-6807 or 209-754-2805. And whereas everyone can support mental health awareness and Awareness Month and California's mental health movement, each mind matters by wearing green. Madam Chair, that is the proclamation. I should ask for public comment. Madam Clerk,
there is no public comment, callers.
Any comments from the board? Very well. With the chair's permission, I would like to call for a motion and a second.
I'll move this item.
Moved by Supervisor Poffinelli, second by Supervisor Stopper. Thank you, gentlemen. All in favor?
Aye.
Aye.
Opposed?
Aye.
Madam Clerk, it carries 5-0. Now therefore be it proclaimed, the County of Calaveras Board of Supervisors proclaims the month of May 2020 as Mental Health Awareness Month in the County of Calaveras, and recommits our community to increasing awareness and understanding of mental health illness, reducing stigma and discrimination, and promoting appropriate and accessible services for all with mental illness. Passed and adopted by the Board of Supervisors of the County of Calaveras, State of California, this 12th day of May, 2020. Thank you very much.
Thank you, Mr.
Thank you.
Clemente.
Thank you.
I'd like to move to item 4.
Item 4 is from the Department of Public Works to proclaim the week of May 17th through 23rd, 2020 as National Public Works Week in Calaveras County.
Is there any staff comments? Mr. Pack, thank you.
Thank you. Really quickly, first of all, good morning, Chair. Good morning, Chair Callaway and members of the board. My name is Joshua Pack. I'm the Director of Public Works and Transportation. I know you've got a really busy day today. I want to highlight just a couple of really quick things of our staff over the last year. And we are asking you to proclaim the week of May 17th through 23rd as National Public Works Week in Calaveras County. We've gotten a lot done over the last year. We look at some of our recent projects, whether it's the O'Byrnes Ferry Road project, Murphy's Drive project, West Point Bikeway and Pavement project. We've gotten a lot done. 2020 should be an even busier year. We have 2 bridge projects currently under construction, Singletree Drive and Hogan Dam Road. We also start the 6 Mile Road paving project here in the next week or two. In the next 60 to 90 days, we'll be starting the Butte Fire Road restoration projects, one on Jesus Maria and another on miscellaneous roads. We're going to be delivering our first gas tax project through Senate Bill 1. That'll start here again in the next 60 days or so. We have a number of disaster projects that will be beginning this summer relating to the 2017 and 19 storms and Mountain Ranch Road project, just to name a few. We've also replaced about $2 million of dilapidated equipment, which means our crews have a better opportunity to serve the public with more up-to-date equipment. It also results in a reduced ongoing maintenance cost, which should set us up well for the long-term future. I want to highlight it's a team effort. We have a lot of different folks in our group, whether it's maintenance and engineering working to maintain or deliver the projects. but also we have a great group of fleet folks who make sure our equipment's working at full time, or a group of finance and administrative folks who work with folks who come to the front counter, who help support our activities. And I want to highlight how proud I am of this group. It's been the highlight of my career working in Calaveras County and giving the opportunity to work with so many qualified and people who care about Calaveras County and care about the work they do and the services they provide the community. And so again, I'm really proud to be able to have the opportunity to work with this great team. With that said, I'm asking the board to acknowledge May 17th through 23rd as National Public Works Week, and take this as an opportunity to reflect on the work that we've performed over the last year, and to give a big thank you to all of the hardworking men and women who make this county so very special. And with that said, I'm happy to answer any questions you may have.
Are there any comments that the board has at this moment? Does the public have any comments on this? Mr. Stopper, could you please do the proclamation?
Yes, Madam Chair. And I did have one comment prior to it. Is you have wonderful staff working underneath you, Mr. Pack. They all do a great job, but part of that is, and for their ability to produce, is having a leader that is able to give clear and concise ways and jobs for them to do and move those things forward. So it's not just your employees, Mr. Pack, it's all the way from the top down that you all work together to get those jobs done, and we appreciate the work you do.
Thank you.
Just a moment, Mr. Stopper. Mr. Mills?
Yes, just a comment only, Josh. I think that your staff has started to see the vision that you have put together and what you'd like to see accomplished. Your background has prepared you well for what you're doing, and I think your staff is on board with what you're trying to do as well. So it's a kudos to all of the people who work in a very sometimes difficult line of work with the weather and all of the conditions involved, and they do it, and they do it well. So thank you and to thank them for what they do.
Thank you.
Mr. Mills, you're right on. Mr. Stopper, would you like to proceed?
Yes, Madam Chair. Whereas public works professionals focus on infrastructure, facilities, and services that are vital importance to sustainable and resilient communities and to the public health, high quality of life, and well-being of the people of Calaveras County. And whereas these infrastructure, facilities, and services cannot be provided without the dedicated efforts of public works professionals who are engineers, managers, and employees at all levels of government and the private sector who are responsible for rebuilding, improving, and protecting our nation's transportation, water supply, water treatment, and solid waste systems, public buildings, and other structures and facilities essential for our citizens. And whereas it is in the public interest for the citizen, civic leaders, and children in Calaveras County to gain knowledge of and maintain a progressive interest and understanding of the importance of public works and public works programs in their respective communities. And whereas the year 2020 marks the 60th annual National Public Works Week, sponsored by the American Public Works Association, Canadian Public Works Association. And with that, I'll ask for a motion.
So moved.
A second?
Second.
Motion by Supervisor Mills, second by Supervisor Tofanelli.
Shall I call for the vote, Madam Chair?
Yes.
Public comment?
Public comment.
Oh, I thought I did that.
She did.
commented.
Did do that, and there were no callers.
Okay.
Yeah.
Oh,
God, I couldn't do it
without that, all those in favor?
Aye.
Aye.
All those not in favor? Passes 5-0, Madam Chair.
Thank you. Mr. Pat, really, on behalf of the board.
Madam Chair?
We appreciate. Yes.
I need to finish the proclamation now.
Oh, dang. Got it. Go ahead. You go for it.
Now, therefore, be it proclaimed, the Calaveras County Board of Supervisors hereby designate the week May 17th through 23rd, 2020 as National Public Works Week, and be it further proclaimed Board of Supervisors urges all citizens to join with representatives of the American Public Works Association and government agencies to pay tribute to our public works professionals, engineers, managers, and employees, and to recognize the substantial contributions they make to protect our national health, safety, and quality of life. And the background music is just killing it.
It works great, Ben. It's like a music video for Public Works.
Mr. Pack, it's been a pleasure having you work for us, and I hope we have a long time of you continuing. And Public Works has done a great job across the county, and we, the continued success will be appreciated. And thank you.
Agreed.
Thank you. Thank you very much.
Thank you. Okay. Oh, look at that little advertisement. All right. I want to move to public comments on any items that are not on the agenda. Madam Clerk.
General public comment. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard. You can see on your screen now, to make a public comment, you can call 669-900-9128 or 253-215-8782. The meeting ID number is 813-6837-5707, and the password is 801891. So if you can please call in now, we will take your calls in the order that they are received. Again, this is for items not on today's agenda. Madam Chair, there does not appear to be any callers.
Yes, thank you. I'd like to move to the consent agenda. And of course, these items are routine, non-controversial, normally. Does any member of the board have an item on consent they'd like to pull? Does any member of staff have an item on consent they would like to pull?
Yes, this is Peter Maurer. I would like to pull item 21. And I'd like to just pull it off the calendar, off the agenda altogether.
Okay, thank you.
Madam Chair, my hand was raised.
Oh, I'm sorry, Mr. Mills. Go ahead.
Well, actually, Mr. Maurer beat me to the punch on item 21. So items 24 and 26.
Okay. Any other staff want to pull an item off of consent? Does any member of the public wish to pull an item off of consent? Well, wait a moment.
Thank you, Madam Chair. While we're waiting for any callers to call in on the consent agenda, I just want to clarify for the record that item 21 was withdrawn completely by the department. Item 24 was pulled, and item 26 was pulled by Supervisor Mills. We have no other callers, Madam Chair.
May I have a motion on the balance of the consent agenda without item 24, 26, or 21?
So moved.
Motion by Supervisor Garamendi.
Second.
Second by Supervisor, I'm sorry. Second by Supervisor Stopper. All in favor?
Aye.
Aye.
Opposed?
Aye.
Passes on a 5-0 vote of the board. Item 21, item 24, Mr. Mills.
Item 24 is from the Office of Emergency Services to adopt a resolution continuing the proclamation by the Director of Emergency Services for public safety power shutdown events on October 3rd, 23rd, 2019 and October 31st, 2019.
Madam Chair, for the record, can we take item 26 together with item 24?
Yes.
Would you like me to read it into the record as well?
Please do.
Item 26 is also from the Office of Emergency Services to adopt a resolution continuing the emergency proclamation by the Director of Emergency Services for PSPS event on October 8, 2019.
Mr. Mills, your question?
Yes, ma'am. Considering that the PSPS events on these two points have to do with something that occurred back in September and October of last year, I would like to know how long it's going to take the staff to close these two declarations out and get us back to a more manageable number of declarations of emergency. I think in looking down the list of other counties in California, we hold the record right now for a number of declarations. So these are some that should be easy to close out. I would like to see us move towards getting that done.
Mr. Osborne, are you on the line?
Madam Chair, he's not. However, I touched base with him on these. The reason why they continue to come forward at this point is because we have filed claims with the state OES and we haven't gotten any response back. So until the claims are closed out, we maintain the declaration so that we maintain our opportunity to continue to receive funds until they get closed out, frankly.
So
from the state level. And we have, my apologies, Mr. Supervisor Mills. It's the same with the Butte Fire declarations as well. That's why we have those open as well.
So as the state hasn't responded to us at all, or is there any timelines that we might be looking at to, closing these projects out?
I don't have a direct answer to that question. I just called John on the phone. He's dialing into the meeting as well. But what I might suggest is, based on your request, if you wouldn't mind, we'll get an update from the state on these and push out an update to all of the supervisors, and we could touch on it next meeting on the data that we have from the state, if that would suffice.
I would really appreciate that, because I think that these two should be fairly simple to move forward with. They aren't as complex as Butte Fire, but if we can get them off our books, it would be very helpful in reducing the workload.
Mr. Mills, did you want to hold up on this, or did you want to proceed?
I would continue the proclamations, the state of emergency proclamations. I just want an understanding of where we're going to be at and how soon can we get them closed out.
Okay, thank you. Are there any public comments on item 24 and 26?
There does not appear to be any callers, Madam Chair.
Mr. Mills,
I'll move the item, ma'am.
both items, Mr. Mills?
I will move both items.
Thank you.
Thank you. Is there a second?
Second.
Second for Supervisor Garamendi. All in favor?
Aye.
Aye. Opposed? Passes
Aye.
a 5-0 vote of the board. Thank you. It's 12 o'clock, and I would also like to be able to do a draft of a letter. So if you all don't mind maybe taking a lunch break. And
Madam Chair?
yes,
Is there any way that we could go ahead and do item 25? I believe that Mr. Pack has stated that it should actually be very routine and non-controversial and could have
What do you mean?
actually been on.
I-29?
Yes, 29. Is that what I said?
No, but that's okay.
Sorry.
I want the date and time that you made a mistake.
No, man, there are plenty. So can we do
Yes.
that?
Absolutely.
Okay.
I'd like to move to item 29. Would you
So item
please?
29 is from Public Works to adopt a resolution incorporating fiscal year 2020-2021 projects into the list of projects funded by SB1, the Road Repair Accountability Act.
Officially good morning, Chair and members of the board. Again, my name is Joshua Pack, and again, I agree with the clerk of the board. This is pretty straightforward. As a matter of fact, that it was more of a clerical issue that this got put on regular agenda and not consent. So this is an action required by the state for us to receive our Senate Bill 1 road maintenance and rehabilitation account funding. That's funding earmarked for projects and programs. The board has previously adopted that through the adoption of our Public Works Capital Improvement Program. The projects in the list that we're sending to the state for funding are exactly match those projects. So again, this is more administrative in nature. The state requires us to adopt a resolution prior to receiving the funding. So with that, I'd open up to any questions you might have.
Colleagues, do you have any questions on this item? I mean, of course, we all went to see if we had a project on there, and Mr. Pack, being as astute as he is, made sure that each of us were on the list.
Different ways.
Are there, if there's no questions from the board, are there any public comments on this item?
Madam Chair.
Ms. Mill, I believe Dennis.
Mr. Mills?
Yes, thank you. I noticed, Josh, in your report out for last month, you had some concerns about the lack of TOT money and how that would affect us with MOE contribution. Is there any feedback from the state and how the SB1 funding is going to be affected with the current declaration of emergency? And, you know, looking at the projects that are on that list, I know you have somewhat prioritized them. Are you fully expecting that all of these will be funded?
Yeah. First of all, I've been in close contact with CSAC and the League of California Cities who are working on this information. Unfortunately, the way gas tax and the sale of gasoline is calculated, it's done 2 months in arrears. And so we won't know the initial numbers until probably mid to late May. We're looking probably the later part of May at this point. However, we'll start seeing those numbers trick in. I think this fiscal year, you're not going to see a dramatic impact. I think most of it's going to leak out into fiscal year 2021. Some of the anecdotal numbers I'm hearing from different counties in the state, UC Davis did a study, are showing a statewide reduction in in vehicle miles traveled by 40 to 50%. And so gas tax is pretty complicated. Part of that is related to part of the gas tax is the actual vehicle mile, the sale of gasoline, but others are vehicle license fees and fees put on electric vehicles. And so part of that will be affected more than others. It's going to take a while to flesh that all out, but we should have an idea probably at least by the end of this fiscal year, by the time we adopt final budget, to have a better idea of how that's going to affect us. Probably not much this year, more next year. But the one thing I will say, and I don't want to make this standard operating procedure, is the fact that we haven't delivered a Senate Bill 1 project in the last couple of years, and we've talked about this, it actually puts us in an advantageous position because now we have this money sitting here ready to be spent. And so we have a large backlog of projects to deliver. We'll be a little more careful. We don't want to spend it all in one shot. And that's not our plan, but we'll slowly meter these out over time, which will really kind of bend that curve, no pun intended, with COVID-19, to really kind of level out our purchases and our projects over the next couple of years related to that. So I think that's the one of the silver linings here is the fact we haven't delivered projects really puts us in a good position to move forward and support projects in the next couple of years.
Joshua, I'm thinking back to Triple Flip, and that the state, when they were in a budget crisis, came in and raided counties. Do you see this money as being firm money, or do you see them as potentially next year, because of the budget shortfalls, raiding some of these funds to make up for their imbalance?
Yeah. So in 2010, Governor Schwarzenegger at the time did make a loan, and that is constitutional protected in the state. They can make loans off gas tax as long as they pay it back over a period of 10 years, and they did that. They can only borrow it once over a 10-year period. I have not yet heard from our legislative representatives that those efforts are being considered. I think they're looking at a lot of other things. I think a lot of people who had to bear the brunt of Senate Bill 1 and the gas tax, and folks lost their jobs after it. They know how important it is. I think they'll be thinking twice about taking the same actions in 2020 that they did potentially in 2010. Doesn't mean that there isn't stuff off the table. I haven't heard anything concrete yet from any of our electeds. We'll continue to monitor that, and if we do see that, obviously, we need to advocate for, at least on my behalf, I need to advocate as the Public Works Director for those funds. But as of right now, I have not seen any tangible proof, evidence that they're looking to transportation dollars to backfill budget shortfalls.
Thank you. I appreciate it.
Any other board comments at this time? Madam Clerk, have we received any calls from the public on this item?
No, we have not, Madam Chair.
Okay. And seeing that there's no discussion by the board, may I have a motion, please?
So moved.
I'll move this item, Madam Chair.
By Supervisor Mills, second by Supervisor Tuffanelli. All in favor?
Aye.
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 Opposed? Passes on a 5-0 vote of the board. Thank you. We're going to take 1 hour break. We will return we're going to take a 55-minute break. We're going to return at 1 o'clock.
I'm ready.
Good. Thank you. I'd like to reconvene the Board of Supervisors meeting, and I want to go back to item 2, authorizing the board chair to draft a letter. I'm not sure who to go to. Do I go to where's Mr. Oh, there he is. Mr. Stopper, Mr. Alt, or Ms. Calloway? Mr. Alt, did you have something you wanted to share with us regarding Mr. Stopper's letter, regarding my letter, regarding where we need to hurry up and move to?
Well, ideally, we need a letter as soon as possible. So I sent out what Supervisor Stopper had developed. I sent it out to all the board members, and I sent 2 other examples from counties that are already approved for variance. Did
you send out mine?
No, I asked you if you wanted me to do that, and you kind of threw your hands in the air and said some words that couldn't be published.
I do
that. So I'm happy to do that if you want to read them both. I do have yours.
There's Butte counties.
So, Madam Chair, I hate to interrupt, but if something's been provided to the board, do we have the ability to share that with the public as well and the clerk?
I would assume we could read it publicly.
I don't have it.
Well,
I'll forward it to you.
I can do the same, but
Go
Supervisor
ahead.
Better, one
Stopper,
of
since
you
you
could
have,
read it so that it's in the record on the
Yeah,
video so the public knows what it is.
Why don't we let
Or
Mr.
share
Alt
your
do it?
screen.
Mr. Alt, yeah, I'm sorry, Dan. Mr. Alt, do you want to read the letter from Butte County? Let Mr. Stopper read his.
well, do you want to start with Butte and El Dorado's letters, or would you like to have Supervisor Stopper read the one that he's modified after hearing all the comments?
Okay, Mr. Stopper, do you want to go ahead and read yours?
Yes, Madam Chair. Per the requirements defined by Dr. Angel in the May 7th, 2020 variance to Stage 2 of California Roadmap to modify the stay-at-home order, guidance to county governments, the County of Calaveras Board of Supervisors would like to convey support for the attestation of the Public Health Officer variance attestation. Calaveras County has had 13 cases in the last 2 months with none active and fortunately 0 deaths. We would also like the governor and the state to consider the state of order of emergency in giving control back to the counties in accordance with state law. Every county has a unique set of circumstances across the state. Calaveras County, along with many rural counties, are unique in that we are geographically, socially distanced to a certain capacity. We do not endure the issues of urban areas. As the state and governor have acknowledged, a one-size-fits-all does not fit with the diversity in California, geographically, urban, rural, and so on. It is not a loss of life we are currently dealing with in Calaveras County, it is a loss of livelihoods. As with many of our brother and sister counties in the state, we believe we can move forward in a more expeditious manner through the different levels of opening in a safe manner, mindful of health and livelihood at the same time.
Mr. Alt, would you like to read Butte County's?
Sorry, I was muted. I'm bringing it up as we speak. So the first part is very similar per the requirements defined by Dr. Angel on May 7th, 2020, variance to Stage 2 of California's roadmap to modify the stay-at-home order, guidance to county governments. The Butte County Board of Supervisors provides this letter of support for the written attestation submitted by Dr. Andy Miller, Butte County Health Officer, to the California Department of Public Health.
That's it. I love it. Says exactly what it should. I have one, which
can I say something here that Marina?
Yeah.
During the course of lunch, Governor Newsom had a news conference, and Butte and El Dorado County are now cleared to move forward. So, right. And according to the email that the CAO Alt sent, there's a copy of the El Dorado letter in there too, and it's a little bit more detailed than the Butte County one.
Did you want to read it?
If we can have him read that one also. Yeah.
Did you want to read it?
Mr. Alt, can you please read that one also? I'd prefer CAO Alt read it. It's his email.
Dear Governor Newsom, our board met today to discuss El Dorado County proceedings with Stage 2 of the State of California's pandemic roadmap. Upon review of the public health officer's attestation of readiness, as well as the containment plan prepared by the health officer and emergency operations center, our board strongly supports allowing Stage 2 businesses to proceed with all aspects of Stage 2 as soon as they have finished developing and implementing their plans in accordance with the state's guidelines for their respective industries. We also received the letters of support written by our 2 local hospitals and the letters of support from city councils, the cities of Placerville and South Lake Tahoe. We listened to a presentation from Dr. Williams fully describing the county's readiness to move to Stage 2 that was presented to our board at a special meeting on April 28th. We heard public comment on that presentation on that date and took additional public comment relative to this matter during a special board meeting this morning where Dr. Williams presented her complete variance attestation. All of the evidence presented supports our determination that El Dorado County is ready and prepared to safely undertake all of the business and activities set forth in stage 2 and is fully prepared to address any potential increased infection or hospitalization rates that could result in a timely, effective manner, including reinstating restrictions as recommended by the health officer as described in the attestation. In conclusion, our board has determined that El Dorado County has well surpassed the minimum readiness standards and is in excellent position to maintain them for the long run, and we fully support Dr. Williams' variance attestation.
Thank you.
Okay. Well, I have one. I mean, my favorite is Butte's. It's right to the point of what we want. And I feel like we didn't address the health of people, but I did. Mine is the Board of Supervisors supports our public health officer's variance for attestation to stage 2. Calaveras is in a strong position to move through stage 2 and still support the health of our residents. We have met the criteria, including those residing in long-term care and our jail. We will continue to collect and monitor data to show that our variances do not have a negative impact on residents, our businesses, or our hospital. Working with our business sectors on the conditions to operate, we will rebuild our local economy and balance the health of our county. The board hopes you will post our variance for attestation quickly so we can move forward to engaging our residents and business community. So there you go. You have 4 options for it, or some permutation of them. Okay, my vote is for one as simple as Butte counties.
I would move Ben Stopper's letter, Supervisor Stopper's letter.
I'll second that.
Okay, there's a motion, there's a second. I will vote on it because the goal is to get our variance of attestation posted. I do not like the letter. I think we don't even address the health of our residents. It's all about opening up the county. And I'll vote for it, but I do not support it. So we have a motion and a second.
I do have a question to Ben.
Pardon?
I do have a question to Ben.
Oh, yes.
Yes, sir.
Would you be, I noticed in the El Dorado letter something about not a partial stage 2. In other words, they're fully prepared to go and do all of stage 2 now. Does your letter adequately, clearly state that? I'm approving what you're saying. I'm just simply wanting to be sure that it's clearly understood. We're not talking about a phased stage 2 approach here.
It says specifically, per the requirements defined by Dr. Angel on the May 7, 2020, variance to stage 2 of California's roadmap to modify the stay-at-home order. And it goes through the guidance, but it does not specifically say all of stage 2, but it, it says stage 2.
If I might interject, my understanding of stage 2, and I'm looking at the state's website right now, is that if we're approved for a variance, we can move into all the next level items that are identified in the state plan that are in stage 2. We can't move to stage 3, but everything that's left in stage 2 is open to us if we're approved for a variance.
I just find it rather interesting El Dorado County would insert that if they felt that there were going to be piecemeal effect on stage 2. And I do have the letter from them here. So
we all have it.
Yeah.
I mean, I'll just say that I think as a legal matter, I don't think you need to say, it's whatever the plan lays out and what is submitted. And so I don't think it needs to say that in order to permit us to do just that, if that's what, if the plan is accepted.
Yeah, my point is El Dorado really didn't need to say that then if that wasn't necessary.
So new guidance that came out, it's the same page that I pulled the Butte County and El Dorado County resiliency roadmaps from, identifies early stage 2 as curbside retail, manufacturers, logistics, childcare. The late stage 2 is office-based businesses, select services, which include car wash, pet grooming, landscaping and gardening, destination retail, dine-in restaurants, and other amenities like bars or gaming areas are not permitted in stage 2. Outdoor museums and schools with modifications. Anything that's not in that definition is stage 3 and is not allowed. Anything that's in that definition is approved if we're approved for a variance. And so the state now has defined very tightly what's in early stage 2 and late stage 2 and those things that are in stage 3. So if we're approved for a variance, we can move through to all of the things that are listed in the remainder of stage 2.
And to piggyback on that, our attestation does say full stage 2, all of stage 2 as soon as it's posted.
Thank you, Sarah.
Any other comments or discussions on this item? I have a motion and a second. All in favor?
Aye.
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 Okay, passes on a 5-0 reluctantly. All right.
So sorry, so just.
Do you want to type up, I'm sorry, Mr.
Yeah,
K.
so I was just gonna, as a logistical matter then, sorry, Supervisor Topanelli, did you? Oh, sorry. I thought I maybe cut you off. So that needs to go on the board's letterhead then. And so can someone please send the body to the clerk so that can be facilitated?
If it's okay, Sarah, and okay with the board, I'll format it in appropriate letter format so it's finalized. It'll only need to be copied and pasted onto board letterhead, and I'll shoot that right off.
And I don't want any dear and sincerely's.
Yes, Governor Newsom.
Governor Newsom. But I don't know why we're sending it to him. That's not where it's supposed to go.
I believe it's to CDPH.
The CDPH.
I'm just looking at the El Dorado letter. I'll look at Buttes and see where they addressed it as well. But I'll complete that and shoot it over to the clerk's office.
Yeah.
Diane and Rebecca, would that go to both of you for the board letterhead?
You only have to send it to me. I'll take care of it.
Okay. So we're going to have quite a long meeting, and we need to get the letter signed and given to Dr. Kaleda or Mrs. Stranger now, don't we, Mr. K?
Yes, I believe that's what they're waiting for in order to submit to the state. So I would just ask that perhaps once it's over to the clerk, we just take a quick break so that it can be put on letterhead and that your signature can be facilitated.
Got it. Thank you.
Absolutely.
Okay, let's move to item 30.
Sorry. Just a moment, please.
Diane, we can't hear you. Oh.
My apologies. Item 30 is from the Clerk of the Board of Supervisors to assign members of the Board of Supervisors to the Juvenile Justice Coordinating Council for the remainder of calendar year 2020 as the Board of Supervisors representative and the Board of Supervisors alternate. So this is a group that we have historically assigned a representative and an alternate to. When we did our review of all of the board's assignments in the last year, There was no feedback provided about this group, so it was dropped from the assignment list. It is required that we have a member, and I believe that Sam Leach is on the call, and he can answer any questions that you have that may specifically pertain to the requirements.
Okay, Mr. Tuffanelli, you were always interested in this. Would you like to serve as the, the chair doesn't make the appointments, but I know it's an interest you had. Would you like to be the representative?
If nobody else is interested, I'd be more than happy to sit on this.
Okay.
Hi, Sam.
It's in. Mr. Leach, is there something that you would like to address on this?
No, I just appreciate the support and sorry for the confusion. It probably should have been handled on my end last year and I didn't catch it. This is something where there were some modifications made at the state level that were a little confusing. A lot of counties got confused and the meetings kind of became defunct, but the meetings are still required. So we need to get them back going to make sure that our revenues are appropriately looked at by this Juvenile Justice Coordinating Council. So I'm planning on having a meeting very, very soon to make sure that this year's plan is approved.
Thank you, Mr. Leach. Is there a member of the board who would like to serve as the alternate? If not, I will serve. Mr. Garamendi, did you want to? No.
So, ma'am, if you want to do it, it's yours.
Oh, well, I served on it for years. That's just why I thought it was appropriate that it was defunct. But sorry, Mr. Leach. So I'll be the alternate. Okay, thank you. Do we need to take a vote on that?
You need to have public comment, Madam Chair.
Oh. I missed my little sign that says public comment. Is there any public comment on this?
We do not appear to have any calls. The number is on the screen. If we could leave it up there for a moment in case anybody wants to call in. I would just stamp it.
Okay.
It doesn't matter, whatever. There doesn't seem to be any public comment, Madam Chair.
Okay, thank you.
Madam Chair, may I move that Gary Toffanelli be assigned to the board with you as an alternate?
Okay. And what about me?
No, Ms. Calloway as the alternate.
Thank you.
Second.
We have a motion. Do I have a second?
Second.
Second by Mr. Garamendi. All in favor?
Aye.
Aye. No, I didn't see your lips moving, Gary. Passes on a 5-0 vote of the board. Thank you. Okay. I'd like to move to item 31.
Item 31 is from the Planning Department to conduct a public hearing and adopt a resolution denying the appeal by the Lakes Treatment Center, Bernadette Catania, Scott Frazier, and John Payne of the Planning Commission's approval of the planned development permit for a public day use recreational facility at Tulloch Reservoir.
Thank you. I want to open the public hearing on this and turn it over to the Planning Department for any opening staff comments. Mr. Maurer.
Good afternoon. Thank you, Madam Chair. Peter Mauer with the Planning Department. This is an appeal by a group of 3 adjacent property owners filing a single appeal of the Planning Commission's action to approve a plan development for some bird chirping in the background. There has been a request to have this item continued by the appellant. And I think before we get into the meat of the hearing itself, it'd be good for the board to discuss whether or not you feel it would be appropriate to appeal this hearing to a future date, or whether or not to continue it or continue on with the discussion today and take action today on it. My recommendation would be that you allow the appellant and the applicant to have a brief presentation to the board on just the issue of the continuance. And then should the board decide not to continue the item, then we will go into the full discussion of the hearing itself. Is that acceptable to the board?
Yeah, thank you, Mr. Mauer. Does the board have any questions or need any clarification at this point? Okay. So I'm going to give the appellant and then the applicant 5 minutes each to deal with just the item of the continuance. I'm assuming Mr. Frazier, or if he's still representing the group, or who's going to speak on behalf of the appellant.
Diane?
Yes.
Diane, it's Bernadette. So I'm not sure if you got my email this morning. On the advice of my attorney, I have rescinded my having Scott Frazier be our agent so that I could speak for myself.
I received your email and I forwarded it to County Council.
Okay.
Okay.
So I'm assuming that all of the board members, and good afternoon, I should say, I was thinking it was going to be this morning, have received the letter from Mr. Parr, who represents the Lakes Treatment Center, as well as myself, requesting the continuance.
Okay. Is each person going to speak on behalf of themselves on just the item of the continuance? Because I'll split up the 5 minute time.
Yeah, mine is fine. I'm happy to do that. Basically, I'm following the recommendations of Governor Newsom and our County Health Officer, Dean Kaleda. Dr. Kaleda happens to be the medical director for the Lakes Treatment Center. We started COVID-19 procedures for our intakes prior to the governor even instituting his orders. We have been working 24/7. We've been in a difficult position, and this appeal and our timelines started during that. I have included with my packet emails that have gone back and forth, which were very minimal in the last 2 months between the planning department and us. And we requested a continuance early on. I think on the 30th, when she first got back to me, Madeline Flandreau, I said that we were going to need more time. And at that time, we were thinking it would be a couple of weeks that we would be looking at for a stay-at-home order and the shelter in place. And clearly none of us expected that. So again, my facility and my work is 24/7, 365 days a year. These last 2 months, I have been at work 7 days a week, 14 hours a day. I have not time to prepare for this. I have been working on these day use things and issues at the lake, at Lake Tulloch, with Mr. Merle Holman since he passed away 5 years ago. Since 2009 forward, regarding issues at Lake Tulloch, and specifically the compliance issue for Tridam to have this day use facility. So there is a lot of information that I need to get to you, and I have not been able to do that.
Okay, thank you. Is there any other appellant who wishes to speak on just the item of the continuance?
Can I speak? This is John Payne.
Yes, Mr. Payne.
Yeah, my property is immediately adjacent to the Tridam Day Park proposal. And I was caught off guard with the notice that was sent to me that I just received within the last 5 days. And I would have tried doing something on Zoom, but I'm totally unfamiliar with video conferencing, and I'm somewhat uncomfortable about presenting anything this way, other than what I've done in the past has been at a board meeting and do it right to the board. So I was unprepared to do anything. I do know that there were some changes made on March the 12th with the Planning Commission, and I would have liked to have at least seen to make sure that those changes were incorporated, because at the previous commission meeting prior to that, everything had not been included. So I don't want something going through until I've actually seen that things have been incorporated by the planning department, so I can actually see that they actually incorporated what we had discussed with Tridam and that the commission had heard. But I was caught up with this COVID-19 restraints, and they haven't been lifted. Otherwise, I would have been much more comfortable about just coming up there and talking directly to the Board of Supervisors. I'm still concerned that the proposal that was put on there does not necessarily enhance the value of my property, and I wanted to get a chance to make a presentation to at least to the Board of Supervisors regarding that. But like I said, I was caught off guard with this late notice.
Okay, thank you, Mr. Payne. Is there, Mr. Frazier, are you on, or your representative? Did you want to address the continuance? He's not there, so we're going to move on to that item. Does the board want to entertain continuing this item?
Madam
Mr.
Chair?
Hill. Yes.
I think that because of the technical difficulties, everybody who is on this call right now is on a long distance call. Being able to visually provide additional not new information, but to supporting information of what they're trying to say is very difficult at best. We've had technical difficulties today. We've had bandwidth issues with this Zoom call, and there's times where the sound is breaking up here at my location on a regular basis, which is making it difficult sometimes to follow the whole conversation. I think out of fairness to everyone involved, that we should be able to put this off to a date certain, that we can get together and actually do this as something other than a call of this type. So I'm asking to have the discussion postponed to another date certain, that we can actually get a good presentation on it from both sides.
Thank you, Mr. Mills. I did make a mistake. I should have asked the applicant their position on the continuance. So before we move forward with Mr. Mills's recommendation, I would like to ask the applicant your thoughts on the continuance of this item.
Thank you, Madam Chairman. This is Susan Larson here on behalf of Tridam, and I'm also accompanied today by Matt Weber, Tridam's counsel in this matter, and to my left, your right, Tridam's General Manager, Jerem Zimmerman. First and foremost, we want to thank the board for the opportunity to present today and to be heard. And we also want to commend planning staff. They have worked diligently on this project since my initial meeting with Planning Director Peter Maurer in May of 2018. We met with him before filing our application and filed it in the fall of 2018. We have submitted all of the information that's required, and we've been through 2 planning commission hearings that have resulted in a number of questions, and we have answered them all. We want to remind the board that this is a permitted use in the zone. It would provide a much needed public access to Tulloch Reservoir without 0 taxpayer dollars coming from any citizens in Calaveras County. So while we understand the constraints, when the appeal was filed, we were asked to whether or not we would support a continuance until today's date. Given COVID and given the opportunity that we would all have to become familiar with the Zoom process, we also work for and represent public agencies. So we have had to do just what you are doing, and we sympathize and empathize with the challenges to that end. We very much though, although we appreciate some of the questions when we left. For example, when we left the Planning Commission meeting, the Planning Commission, before they concluded their hearing, they took a break and recapped the conditions that had been modified. For example, there was a modified condition to address Mr. Payne's concerns. He wanted a wall along the property line, which we consented to, and there were questions about the addition of some buoys. The planning department, they took the Planning Commission granted a recess and then came back on and read all of those conditions before they approved the project. So when we left there, we thought at least those concerns had been addressed. There was also a request about a gate. So, given that it's permitted use, much needed amenity, no cost to Calaveras County taxpayers, we would very much like to proceed to bring this, this project to fruition. And, employ will be hopefully getting an approval and hopefully employing local people to design and build our facility. So with that being said, we would really implore the board to proceed today.
Thank you, Ms. Larson. Hello, Susan, long time.
Yeah.
Okay. I want to bring the item now back to the board. Mr. Mills made a comment, but I believe I need to have public comment on just this item of the continuance of this appeal. If there's any public comment, please call in now. Thank you. And just as an aside, I am going to excuse myself for a minute to sign the letter so the attestation variance can go out. Sorry, I do apologize. It's still not done. Okay. I'm assuming there's been no public comment on this portion of the appeal hearing.
Yes, ma'am.
That is correct. We do have Scott Frazier on the line. He would like to, he's one of the appellants.
Okay, Mr. Frazier, I will grant you 2 minutes to talk about why you think there should be a continuance if you support that.
Madam Chairman, if I may please ask for a clarification from the clerk. Is Mr. Payne also in the queue to appeal? I'm sorry.
He has already spoken.
Okay, all right. I think I'm on a different timeline. If Mr. Payne has already given his words for why this should be continued, then I'm not going to add anything to it. I was calling in to the expectation that he was expecting me to do it. So I'll leave it there.
Okay, thank you, Mr. Frazier. Okay, I want to bring the item back to the board. Mr. Mills, did you have any further comments you want to make on whether there should be a continuance or not?
Well, and this is not personal to either side of this issue, but I look at the Department of Homeland Security's advisory memorandum on the identification of essential or critical infrastructure workers. I'm really wondering why we're discussing anything regarding planning, because it has nothing to do with life safety. And should we be discussing these kind of issues, considering we are in this declaration of emergency? So I just want to bring that up as a point.
Thank you. Does any of the board members have something? Mr. Stopper?
I have a couple questions, Ms. Calloway. So this appeal has been continued once already. Is that true, Mr. Mora?
When we first received the appeal, because of the time frame that we're provided to hear the appeal and the dates that the board normally meets, it would have been very challenging for us to meet within the 45-day time frame. So we requested that both the appellant and the applicant agree to a continuance to this date, and they both agreed to that.
Understood. So was that 45 days ago approximately when that was agreed to?
Yes, it was about a month and a half ago.
Within the COVID time frame, since after the governor had ordered his issue. That's good enough for me right now.
Okay, thank you.
Any other board member have a comment on the continuance of this? Mr. Garamendi.
Thank you, Madam Chair. We just did a 2.5 hour conversation about trying to get business back and going and opening things up. This is the business of the county, and I think we have to continue the business. I don't like Zoom any more than anybody else does, but we have to try to keep things moving. And so I'm going to support moving ahead with this.
Thank you. Any other comments from the board members? Mr. Tuffanelli.
Yes, thank you, Madam Chair. I'm unclear what Supervisor Mills is asking. Is he asking for a continuance, or is he just making a statement to go forward? I'm unclear.
Mr. Mills, want to
clarify that, Supervisor Mills?
Yes, I'm asking for a continuance to be fair to everybody, so that all of the information can be presented in a way that we all can receive it. As I said before, there's been some difficulty with our bandwidth. You have a bandwidth problem where you are, and the technical difficulties that have not just surrounding Zoom, but just surrounding what we've been doing today. So that's the reason I would be asking for continuance, is to get past all of these technical difficulties so that we can have a fair hearing.
Thank you. I really support the comments of Supervisor Garamendi. There has been a continuance already. We're all trying to work. I totally understand what Mr. Payne said. We're all going through this process. But if we wait, as has been asked, till all this is over, we don't know when that will be. And in fairness to the appellant and to the applicant, I believe we need to move forward. So those are my comments. I do have a motion from Mr. Mills to grant, I'm assuming Mr. Mills, I'm speaking correctly, to grant the continuance. Is there a second? The motion died.
I'll second the motion.
Okay, there's a second by Mr. Tuffanelli. All in favor?
Aye.
Aye.
All opposed? No.
No.
Passes on a no. It fails on a 2-3 vote of the board. We will continue with the appeal.
With that, I'd like to turn it over to Madeline Flandreau to go through a brief PowerPoint and explain the issues before you.
Thank you.
Hello. Let me just get myself organized here. I'm trying to share my PowerPoint presentation with you all, which I hopefully is, on there. Everyone can hear me? Everyone can see the presentation?
Yes.
Excellent.
I guess I should ask the appellant and the applicant. Can you see this?
I think I am on this is Scott Frazier speaking. I think I am on a couple of minute lag. I see the nice people of Tridam on my screen.
This is John Payne. I'm on YouTube, and all I see is the name Dr. Kaleta.
Oh.
They will have to move to live feed. You're all the way at the beginning of the meeting.
Well, I had you guys on earlier, watching everything for the last 4 hours. So if I shouldn't be on YouTube, you're suggesting I go somewhere else?
Madam Clerk, can you
suggest that?
Just maybe verbally give what the Calaveras County CA.IQM so that people can see that to view the live stream?
I'm sorry, Madam Chair, but IQM2 has a longer delay than YouTube does.
Oh, okay.
So YouTube is the best viewing source to actually just view the meeting. It is the closest to real time. And then maybe the caller can, I don't know if they're just calling in or if they're using the phone number or what they're doing, but he could refresh, if there's a delay, too much of a delay, he could refresh the page on.
Right now, on
we're
YouTube,
monitoring the video here, and it is current.
I have refreshed the page, and I see the first page of the PowerPoint presentation.
Okay, how do I refresh the page on YouTube?
It's like an arrow that goes around in a circle in the upper left-hand corner of your browser.
Thank you, Mr. Frazier.
Okay, I see it. Thank you. I got it.
Okay, thank you. Ms. Flandreau, could you please proceed?
Of course. Good afternoon. Thank you all. I'm presenting the appeal of the Planning Commission's approval of Plan Development Permit 2018-064 for Tridam to develop a day-use recreational facility to provide public access to Tulloch Reservoir. The proposal includes picnic areas, a fishing pier, car top launch facility for non-motorized boats, restrooms, and parking. And I'll begin with a brief description of the site and the approved project before I go into discussing the details of the appeal. The subject parcel, APN 064029062, is located at 7430 Oberns Ferry Road in Copperopolis, and it's zoned C2PD, which is general commercial with the planned development combining zone. This is a Google Earth image from 2016, which gives a pretty clear view of the parcel, the retaining wall, the trees, the existing encroachment. Not much has changed since this has been taken. The site is still undeveloped, except of course the water level fluctuates, as you all know, since this reservoir. This is the site plan that was approved by the Planning Commission during the previous hearing. And I'm going to zoom in so you can see a little bit better, showing the day use facility, which includes the electronic access gate, a 20 by 30 storage structure, a 2-unit restroom, 5 picnic tables, a 50-foot fishing pier, the launch for the non-motorized watercraft, and the gray area includes the encroachment and the parking lot. The facility will gain access from Oberns Ferry Road by improving the existing encroachment, and the facility will be operated by Tridam, which will include a security system, an electronic access gate, and locking restrooms to ensure security and inaccessibility from dusk till dawn. This is the view looking south of the existing encroachment. The location of the proposed parking lot, the structure you see at the end there is Mr. Payne's residence. The proposed picnic area and the site of the proposed boat launch and the 20 by 30 storage structure. Staff presented application 2018-064 for the plan development permit at the Planning Commission hearing on October 24th, 2019, during which all of the appellants were present and expressed concerns about the proposed facility, such as an increase in traffic along Oberns Ferry Road and traffic safety, water safety, and negative impacts to the neighboring parcels from trespassers. During the October hearing, the Commission expressed concerns regarding the project and requested a traffic study to be conducted and further information regarding fill, which was placed at the site. The item was continued, which allowed staff more time to update the initial study, the secret document, with this new information and recirculate the document for public comment. Following the recirculation of the secret document, the application was brought back before the Planning Commission on March 12th, 2020, which approved the permit 4-1. Subsequently, on March 26th, 2020, the Planning Department received an appeal of the approval of the plan development permit. The appellants are all adjacent and neighboring landowners. Mr. Scott Frazier is the owner of the parcel directly adjacent to the north, which is 7540 Oberns Ferry Road. Mr. Payne is the owner of the parcel directly adjacent to the south, 7360 Oberns Ferry Road, and Bernadette Cantaneo is the owner of the Lakes Treatment Center, which is located just south of Mr. Payne's parcel, which is 7260 Oberns Ferry Road. The appeal requests that the Board of Supervisors overturn the Planning Commission's approval of the PD permit due to multiple concerns about the proposed day-use recreational facility. And although staff understands that the appellants have concerns about the facility, the use is permitted by right in the C2 zone. The land uses permitted within the base zoning district aren't affected by the inclusion of the parcel within the plan development combining district. The plan development combining district basically allows for the review of commercial development plans to encourage design innovation and provide more detailed county project review than would otherwise normally be allowed in the base zone. The reasons given for the appeal don't really provide any evidence that the applicant hasn't satisfied the requirements of Calaveras County Code section 1750-060 for the plan development combining zone. The purpose of the PD zone is to regulate site development and aesthetics, not the type of use. The performance standards, which I've included here in the presentation, are part of the findings that the Planning Commission makes during approval, and they include landscaping, compatibility with the location, screening if applicable, rooftop devices, which was not applicable in this case, signs, parking, and refuse storage. The Planning Commission reviewed the application in 2 public hearings and approved the development plans, the site development plans, making the determination that the applicant had satisfied all of the requirements of section 1750-060, as well as being consistent with the neighboring land, being consistent with the general plan and Title 17. A traffic assessment, was conducted, and Public Works concurred with the findings. The secret document was updated and revealed no new potentially significant impacts. And there were conditions added by the Planning Commission, including the concrete wall, which was discussed. It was a request by Mr. Payne and discussed between Tridam and Mr. Payne that they agreed upon a design and location for the wall, as well as an access gate. Also signage prohibiting trailers and stating maximum vehicle length, and an additional site plan for buoys with signs to indicate the no wake zone and no motorized vehicles. The appeal letter contains multiple bullet points, which I included in the staff report with my responses. But if any members of the board have any questions regarding any of these points, I'm happy to answer any questions that you have. And I know that Tridam also has Mr. Joe Murphy, who is the licensed surveyor who can speak on to the effect of the issues with the access easement that Mr. Frazier discussed in his letter. And if you have any questions for me, please.
Does the board have any questions of staff at this moment? Okay. I'd like to
Chair,
pardon?
we can't raise our hand the way the screen is set up.
Oh,
then let me stop.
Good.
There
Thank
we
you.
go.
Good catch, Mr. Mills. Thank you.
I do have a question. It's
Yes.
go back to the site plan. I think that was slide number 2. If you could show that to us. Stop.
Yes.
On this, there's a dashed line that runs along that edge right there. What is that dashed line? I don't have a way to point it out on the screen, but
is it labeled? Can you help me identify it a little bit better?
yes, from the gate towards the lake, and then all along there's a line along there, probably 20 feet off of the road.
The property line.
That's a property line?
Does it have the 139 point?
Yes.
Yes,
Yeah.
that's the property line.
That is the property line. So they will then need an encroachment to put the gate on something other than their property?
Yes, that is all done through the encroachment permit process.
Including the vegetation or whatever needs to be done in there, in that area?
Yes.
Okay. That's my question for now. Thank you.
Thank you, Mr. Mills. Any other board comments or questions at this time? I'd like to give the appellant 15 minutes. There are 3 of you, so you can decide how you would like to do it. I can give each of you 5 minutes, one of you 10, one of you 5. Do all 3 of you wish to speak? Mr. Payne? Mr. Frazier?
No, I'm here. Sorry.
Oh, Mr. Payne, did you want to speak to the appeal?
Yeah, I wanted to bring up one item that I
Okay,
noticed
we'll get to you. I just want to see how many of you wish to speak and how we'll divide the 15 minutes. Mr. Frazier? Ms. Candino, did you want to speak or your attorney speak for you? Okay, am I not clear?
Madam Chair, I'm not seeing Ms. Catania on the call any longer.
She mentioned she had an attorney. Well, okay, as we go, Mr. Frazier, I see you're unmuted. Did you want some time to speak?
Yes, please, Madam Chairman. I would like to go after Mr. Payne if that's acceptable to him.
Okay, fine. Thank you. Since Bernadette's not with us, I'll just give each of you 7.5 minutes. Mr. Payne, could you please proceed? You have 7 minutes.
Can you wait until I can get a timer set and started for that amount of time, Madam Chair?
Oh, I've got my timer, but you can go ahead. Let me know.
I only have one comment. Not going to take more than a minute. Yeah, the presentation that was, can you hear me?
Yeah, just a moment. Diane, do you want to just go ahead and do the timer or do you want me to? You can? Okay. Mr. Payne, please proceed.
Yeah, I'm just commenting on the what Madeline had the presentation that she made there. I've now seen what they planned on doing. One thing that was mentioned at the last March 12th meeting was the regarding the no wake zone. I thought they were going to put in a no motorized vehicles, no motorized watercraft zone in there, and I don't see that in there because one of our concerns was people using motorized boats and coming in there to try to access the park. That was what I had.
Thank you, Mr. Payne. Mr. Frazier?
Yes. Is it possible in any way that we could hear Mr. Murphy's presentation, because he may have information that could be, somewhat change what I have to say?
Could someone please confirm with me again who Mr. Murphy is representing?
Susan Larson here.
Oh, got it.
I'm speaking. We actually do have projects surveyor Joe Murphy from Dillon and Murphy Associates on the call. We also have Kenny Anderson, our traffic consultant from Katie Anderson. They are on the call, but they do not have formal presentations today.
Okay, thank you. Mr. Frazier, why don't you bring up the issues you have, and then we will ask Mr. Murphy to talk when I give the time to the applicant.
Very well. Thank you, Madam Supervisor and Supervisors. I actually was able to meet with Tridam yesterday and discussed a couple of matters with them. They have a new general manager there, and he had made some statements to me asking about my genuineness on some of the comments, and I think they were fairly made. He's a new person here. I think is trying to do a good job, and I think we owe to welcome him by setting the tone on this appeal that we're here to solve problems, not to stop projects. So I'm a firm property rights supporter, and I want to support my own property rights, and that means that I should support the rights of others. I have just a couple of points online. One is that I've submitted evidence of an easement It's an easement that I have submitted to this county previously when I requested an encroachment permit. I was granted it. It was well reviewed. The existence of my easement does not stop their project. It doesn't curtail their project. It simply, if it does exist and it's valid, that it should provide me continued access through there, and there shouldn't be any permanent structures built over the top of it. In addition to that, if it's found to be valid, it could be helpful in ensuring that there's good fire suppression access to the area. So I do not think, if you're going to approve this, that it is an unfair condition that we meet with the county surveyor and review my easement and the other documents, and a condition be placed on this that if the easement is found to be valid, that it's not interfered with. And I was told that I was going to meet with the county surveyor or hear from them. I did not. I noticed they weren't put on the circulation for this hearing. So that's something I would like to still be able to see happen, even if this project moves forward as of today. The second is that I'd like to address density and trespassing. I'm very familiar with this parcel. I'm familiar with tourism activity in that area, especially given with my own property and having been coming to this lake for a couple of decades. I am concerned that the nature of this project is that it's being portrayed as a public park when in fact it's a private enterprise. And private enterprise is fine. There's nothing wrong with that. Tridam needs this for their license, and they should be able to do it if that's within the law. There's no objection to that. What I am concerned about is that the public will not understand the nature of this place and that it's going to become a destination. And when people arrive there and see it packed, they're not going to turn back around. And I don't think it's unreasonable to add conditions to this that we mitigate overcrowding on the parcel, and that the site plan that you've seen there is the only place that the public will be allowed, and that steps are taken to mitigate them from going on the raw shoreline and outside of the parcel, or not the parcel area, but the site plan that you see there. I don't think these are unreasonable things. I think a fence should be put up along the entire perimeter of the parcel, so at least on the roadside, to stop or at least try to dissuade trespassing. I've sent you guys some photos and videos from from my last week visit there, where you can see people that go down, they set fires. Those things will be outside of good viewing area from their surveillance system, if their surveillance system is only on the site plan area. And they pose a risk, and we should try to prevent them. So these things together, I think, should require fencing on there as a condition, and probably that's all I have right now.
Thank you, Mr. Frazier. Again, you still have time left on the clock. If there's nothing else either one of you wish to say.
Well, I do want to add that as this goes on, I think allowances should be made for Mr. Payne's property to have some parking area allotted to him, so that a clear path can be left from the gate where you will enter the Tridam parcel, and a fire apparatus can get all the way through to the other exit side. That's what my access easement appears to indicate that is being preserved there. And, Mr. Payne has parks right in front of his garage. And I think that in the interest of safety, that's something that should be looked at. Again, nothing that I've brought up here, I think, are in any way onerous conditions for the approval of this project.
Thank you, Mr. Frazier. If there's nothing else, I'd like to move to the applicant. Ms. Larson, are you going to start it? And
Thank you. Yes, I'm back on, I believe. Hopefully you can hear me. I'll address Mr. Payne's question first. There was extensive discussion about buoys, and as reservoir manager of Tullet Reservoir under the terms of our license with FERC, we do install and maintain buoys at various locations. We work very closely.
Could I interrupt for a moment? I'm sorry, Susan.
Sorry.
Madam Chair?
Yes.
You gave the appellant a time limit. Are you also doing a time limit for the applicant?
Yes, I told them 15 minutes.
So is only Ms. Larson going to speak?
They can divide it how they want.
I need to know how to time it, please.
Oh, so Ms. Larson is a former planning director. You know how to do all this. You will get 15 minutes. And if you want to talk all of it, I'm sorry.
I said I do understand the timeline, and I will try to answer all of the questions that have come forward within 5 minutes to leave the board opportunity to ask questions.
And to have Mr. Murphy part of your 15 minutes.
Correct, and that question might also require Council Matt Weber to weigh in as well.
You have 15 minutes.
Absolutely, thank you so much. To go through the comments, there was extensive discussion at the first and the second Planning Commission meetings. As staff aptly noted, we were first before the Planning Commission in October and again in March. The issue of buoys came up, and Tridem, as reservoir manager under our FERC license, installs and maintains buoys. We do so in great cooperation with your Marine Safety Division and Tuolumne counties as well. We appreciate the collaboration you have with your Marine Safety Office. This particular area is already within an established 5-mile-an-hour zone. So when the question came up, Planning Commission, I reminded them of that. And then there was a discussion about an additional buoy line that would be placed to prevent non-motorized boats. And that would specifically be where our car top launch area is on the site plan. So we expressed those comments at the Planning Commission, and the extra condition was added. We certainly, as we said at Planning Commission, we do not want to impose any additional restrictions on our neighbors. So the non-motorized boating area would be solely in front of where people are launching their car top, their canoes, kayaks, stand-up paddleboards, and that beach area. So it'd be a very small portion of the property there, and we'll be submitting an additional site plan to county staff for review. But we do buoys, we know buoys, and we maintain them all over the reservoir. In terms of the easement, it's one of the reasons why the project was originally continued, because we wanted to conduct an exhaustive research endeavor. So we asked Joe Murphy to pull all of the records pertaining to this property, and we also had our council review them as well, and don't believe that easement affects our project or our proposal before you, and I'll let them address that. The other comment from Mr. Frazier was about density, and perplexing comment to me. Certainly it is intended to accommodate the public, and we believe it will do a fine job of that for the size and the configuration, and it'll prevent trespass that's currently occurring. We do, as staff said, we will have a surveillance system. You may or may not know, but as hydroelectric operators, we have surveillance cameras on all of our facilities, our dams, our spillways, our powerhouses, and we have a control room that is manned 24 hours a day. The system that's installed here will be linked into our control room. So we will have somebody in a chair watching it. Not just the area where the parking lot is, but we'll likely have that frontage which abuts Mr. Frazier's property under surveillance as well. So we will have the ability, if we see something happening untoward, to dispatch our own people. We do not want, as we said before the Planning Commission, we do not want to be calling the sheriff's office if it's something that we can handle ourselves. So we appreciate that should address that issue. And we will be installing fencing or other boulder barricades as we need to make sure that we're not having trespass. As we met with Mr. Frazier and Mr. Payne in the past, their two properties, being vacation rentals, have often had their guests on our property. And we expect once it's an attractive amenity that they may use it as well. So we certainly don't want to deter from that, but we want to make sure that trespass is not a consideration for our property and our neighbors. So we will be addressing that as part of our final plan. That concludes my remarks as to the comments that were raised. We want to make sure, though, that any fencing that we install, particularly out on Burns Ferry Road, we would not want to see a fencing system there that detracts from, number one, safety, from the traveling public, but also detracts from the aesthetic value of looking at the vista from the reservoir at that point. So, but we will be actively working on that. And, I think we need to underscore, as well as we've tried with our neighbors, this is not like a park that will be constructed and then Tridam is gone. We are responsible under our park license to actively operate and maintain it. So we will have a plan for that. We will be going by as needed to make sure that it continues to be an attraction and an enhancement to the community. Easement.
So we did research all the easements that Mr. Frazier had identified. Were you speaking, Madam?
I was speaking. Could you please identify yourself?
Sorry, my name is Matt Weber. I represent Tridam as counsel for Tridam. And we did, after Mr. Frazier brought this issue up sometime last year, I believe it was, we did research all easements we could find on the property, including the ones Mr. Frazier identified. None of those easements across this parcel, and Mr. Murphy mapped all of those easements, provided the mapping, I believe, to the planning department as part of this process. And I'll let Mr. Murphy talk about where the easements actually are that Mr. Frazier has identified, but they are not across the Tridam property. Joe, if you want to address that.
Sure. My name is Joe Murphy with Dillon and Murphy. It was interesting. The easement issue was not one of the bullet points on the appeal. So I thought it was asked and answered twice at the previous two planning commission hearings. Actually, the second one was attended by County Surveyor Robert Packinger. So it was asked, I responded in writing that I've reviewed the deeds to both properties and some surrounding properties. And while there are access easements, utility easements in that area, none of them cross the Tridam property. I've asked the county if they had anything, including Robert, who, like I said, was at the last public hearing, and nothing has been provided. So if there's an easement, I've yet to see it, and I don't know that the county surveyor has seen it. So all easements I've identified are off the Tridam property.
Thank you, Mr. Murphy. Ms. Larson, is that all the comments you have for behalf of Tridam?
Thank you, Madam Chairman. Those are all of our comments, unless there are specific questions that you'd like to ask of our team.
Okay. Are there any questions that the board has of Tridam? Okay, I'd like to open it up to the public. Does the public have anything they would like to ask?
Madam Chair?
Yes, Mr. Mills.
My hand was up.
Oh, you're not the public, Mr. Mills. I haven't gotten to you yet. But
Okay.
do you want me to, can I get back to you in a moment, please?
I'll put you on a timer.
Oh, thanks. No, Diane will. If the public has anything, please call in now.
Do I get a rebuttal as a member of the public?
Mr. Frazier, you will get a rebuttal as an appellant.
Okay, thank you very much.
That, yes.
So the phone numbers to call in are on the screen now, if anyone wants to call in for public comment. There are no callers at this time, Madam Chair.
Thank you. Okay, we'll go to the summation and rebuttal by the appellant and by the applicant. You will each have 15 minutes. Mr. Frazier, did you want to start on behalf of yourself, and then Mr. Payne can join in?
Okay, thank you very much, Madam Chairman. Again, back to the easement issue, I did hire a licensed surveyor, the same as Mr. Murphy. These documents were reviewed and provided. It's in the chain of title that when Mr. Holman sold this property to Tridam, and I'm not asking anyone to deny this project based on that. I'm simply asking that a condition be placed in, that we continue to work through it, and if it's discovered that the easement exists and is valid, then no access for me is blocked and no permanent structures placed over the top of it. And I do not think that is an unreasonable condition to place on this. The fencing, I think, again, it is very important that we discourage people from believing that they can use this entire shoreline in the manner of which it is being used in small doses right now, which is trespass, with people building fires, causing erosion, leaving litter, noise pollution, and other problems. We need to discourage that. I believe that can be done with a fence with some transparency, such as chain link, of a reasonable height to discourage trespassing, to discourage people from jumping the fence, and will still not block any aesthetic characteristics of the lake. I do not think these are unreasonable conditions to place on this, and it in no way impacts the site plan that they have presented, other than it might shift over a couple of feet the structure, the shed structure, if my easement is found to be good. No one has sent me a single document refuting the documents that I did submit to the county, and I simply ask that we continue to work through them where they can be proven to be valid. And I think these are very simple requests, which I would hope my good neighbors are interested in supporting. Thank you.
Thank you. Mr. Payne?
I have nothing to add at this point.
Okay, thank you. Tridam, Mrs. Larson?
Oops. Hello, Susan Larson here. I would just reiterate that, on the easement issue, we did an exhaustive research effort, actually, I want to say last summer, well before the scheduled first planning commission hearing, and submitted all that data to planning. I believe it was also available to Mr. Frazier, and as Mr. Weber and Mr. Murphy both attested to today, they can find no record of any easement. Thus, we would not, be supportive of the addition of a condition when no evidence has been presented to date in well over a year and a half that it does affect our property. And going forward, in terms of the trespass on the property right now, we are seeing some people use the site, and quite frankly, it happened after the March 12th Planning Commission approval. There were records, stories in the local newspaper, and my mother-lode people got excited, so they started coming there. But during the time we've owned it, and before that, I checked with the local fire department, and there's no record of any fires on that property. And again, once we get an approval, there will be pavement, there will be grass, there will be fewer things that could catch fire. So I think the potential impact of fire, if there was any, is greatly reduced as we develop the site. So I don't believe there's an issue. And it will take us some time we're a public agency, so we'll have to go through the public agency bidding process. It will take us a bit of time to go to final design and to get this facility constructed. But until then, we will still be actively monitoring and maintaining what goes on there to make certain that that it does not propose a risk, that it does not pose a risk of any sort. In terms of fencing all along Burns Ferry Road, that is a very attractive vista there that people driving both directions see. Coming from Tuolumne County, it's your first real vista once you get over the bridge. It's open. We'd like to keep it that way. That being said, there are other things that we can do there. And we've already talked to Public Works quite some time ago about some combination of rocks, boulders, and drought-tolerant landscaping that could keep people, and perhaps no parking signage along there that would deter parking. We don't want people parking there either. I'm sure Mr. Payne, when people are at his vacation rental, sometimes they park along the road, and he tries to discourage that as well. So we'll all be working to do that to make sure, as I said from the onset, you have our complete assurances that this facility it will be an enhancement to our neighbors and to the entire community. No further remarks other than to again thank you for your time.
Thank you, Ms. Larson. Staff, do you have any closing comments at this point before I bring it back to the public and then the board?
I would, yeah, I would like to address the access easement a little bit further. Mr. Frazier provided me with a copy of his deed last summer as I was preparing to take this item to the Planning Commission. And his initial email said there's this access easement, this needs to be reviewed. I subsequently spoke to Susan Larson. She hired Mr. Murphy in order so that I could include a statement from a licensed surveyor stating whether or not this access easement crossed Tridem's parcel. And as you know, his determination was that there was no access easement. I've asked Mr. Frazier to provide additional information, and I still have not received anything. I had hoped that I could bring the statement from Mr. Murphy and a statement from Mr. Frazier's surveyor to Robert Packinger so that he could make a determination, but I never received anything from Mr. Frazier that I could bring forth to the county surveyor. So that was essentially where we've been standing with this issue for the better part of a year. So I was very happy to, talk to Mr. Frazier about this access easement and was waiting for additional information from him, and I never received it.
Oh.
Okay, thank you. Mr. Maurer, did you have anything else that you would like to address on this?
No, I was just going to confirm what Madeline had just said regarding the information. I'm not a surveyor. I can read a legal description, though, and my reading of the documentation that Mr. Frazier provided to us did not show any easement across that piece of property. But again, we had asked Mr. Frazier to provide us additional information that would demonstrate that there was indeed an easement, and we have not received anything from him that we could then review with the county surveyor.
Okay.
May I please rebut that?
No, Mr. Frazier, you cannot.
Okay, thank you.
All right, there's no board comments at this time. Questions of the staff. I want to open it back up to any members of the public.
Pardon me, Madam Chair. There was one question. I think that Ms. Larson had indicated there was a revised site plan. I just want to clarify that we're not looking at a new site plan that we haven't seen yet, but just something that was either in reference to the Planning Commission's conditions or, what was her reference to the site plan?
Ms. Larson?
Thank you, Mr. Maurer. Yes, thank you for asking for clarification. We do not intend to submit a revised site plan. It will just be a detail of the buoy markers that we intend to install around the launch area.
Okay, in response to the conditions of the planning.
Correct.
Great,
yes.
Thank you very much.
Yes, thank you.
Thank you. If there's any public comments to what has been said, could you please call in?
Madam Chair, there doesn't appear to be any public comments.
Okay, thank you. I'd like to bring this topic back to the board. Do you have any questions or comments? And I am going to start with Mr. Mills.
Thank you, Madam Chair. First of all, I need to be sure everybody understands. So Mr. Weber is also one of the attorney of record for CCWD. And the issue of the easement there is not a utility easement that CCWD had any involvement in, as I recall. Am I correct, Matt?
Mr. Mills, the issue that Mr. Frazier raised was that he believes his deed provides an easement across the property. Had nothing to do with any utility easements across the property necessarily related to CCWD, just that he has an easement. It is not that we have been able to determine anywhere on the property. He has an easement on another piece of property, not Trident's property.
Yeah, that's kind of what I was remembering there. I just wanted to confirm it with you. If we're going to be placing buoys, are the buoys going to be out further into the active portion of the lake than they currently are?
And no, Supervisor Mills, there are existing 5-mile-an-hour buoys that are in this area and have been for the past 15 or so years. The buoy line that I'm talking about will be right immediately adjacent to the car top launch area. Just a small buoy line around there to restrict people from pulling in a motorized vessel and interfering with people trying to launch their stand-up paddleboards. It will not extend out into the channel whatsoever.
Okay, so we're not talking about a reduction in the use of the lake or creating a 5-mile-an-hour zone that wasn't there before.
Absolutely not. There's an existing 5-mile-an-hour zone there now. And our buoys would be pretty close to the shoreline there, right immediately adjacent to the car top launch area. So no new restrictions.
Thank you.
Similar to buoys you might see around some of the homeowners associations that have little swim areas. Something very close to the shoreline.
Thank you. So you're going to be doing everything possible to keep motorized boats from coming in and accessing the beach area there. Is that the point?
But that is correct.
Okay. And knowing that there's currently an opening between Mr. Payne's property and this property, is there any way for the fire district, and I'm not speaking on their behalf, but that they could get some way of, if they got blocked in there, that they could simply drive on through and come out on Mr. Payne's property as an emergency exit?
Absolutely. This was addressed at the Planning Commission meeting. I think both Planning Commission meetings, and was specifically discussed at the March Planning Commission meeting. There will be a gate there, a vehicular access gate that would have a lock, but perfectly accessible to the fire department. And it would be a way to, if they needed to get into Mr. Payne's property, and the access on the other side at the treatment center was blocked, they could come through our property to get to his as well.
Excellent. I know you're probably aware of the left turn pocket there at Poker Flat that just recently was installed, and we have a lot of turn pockets along the Burns Ferry, probably because of the speed that's involved there. If in the future it becomes necessary to install a turn pocket for safety, how are we going to be able to deal with that?
Well, we were specifically required, although our project site is on a piece of property zoned general commercial, and it is the use that we're proposing is a permitted use within the zone. And actually, as the planning staff will likely attest and the planning commission acknowledge, the use that we're proposing, day use only park, is probably far less intensive than the bulk of uses allowed in the C2 zone. But nevertheless, when the issue was raised, we acquiesced and had a traffic analysis done, and that showed that based upon traffic volumes, traffic needs for our site, a left turn pocket was not required. And for the use that's proposed, it isn't like a commercial business. This will be it, a public park, day use only. So it's not like a commercial business that maybe starts out with a 2,000 square foot office building and expands over time, and therefore traffic increases. The number of parking spaces is finite. And it's day use only, and day use only is what we're required to do in our license. So there would never be a request from Tridam to operate a campground or something more intensive.
Okay, you're leading to two questions. One is that day use only means that you will be locking it off at night and providing security so that people don't wander around there after hours?
Absolutely. As staff pointed out, it was part of our proposal that there would be a self-locking gate that closes at dusk, and the same with the restrooms. If you're in the facility, you can get out, obviously, for safety considerations. But we've installed in other recreation facilities, particularly up at Beardsley, and we network with other hydro operators across the country. They're self-locking, but in a safe way. But again, our camera system that's operational 24 hours a day, 7 days a week, will let us see it. So we're not going to be relying necessarily on somebody driving by to see it. As I said from the onset, we have 24-hour day, 7 day a week person in our control room monitoring all of our critical energy facilities, and this will be added to that.
So when was the traffic survey done?
Before the last planning commission meeting. It was done actually before staff. It was in between the October 24th, 2019 Planning Commission meeting and the March 12th. I believe it was submitted to county staff, perhaps November, December, and that was evaluated by the Public Works Department and used by the Planning Department in the preparation of their updated initial study and CEQA document.
I would be concerned about doing a survey in essence, slowest time of the year. I know that the traffic flow across the Burns Ferry Bridge that sometimes equals or betters Highway 4 at Main Street in Copperopolis. Knowing that, and also that that's a 55-mile-an-hour zone through there, there's been no effort on our part to do a speed reduction through that zone because there's no accident history to really drive that. I'm concerned about the traffic volumes that you may have come up with and whether or not those are really appropriate to a peak season use.
Well,
can you address that?
And Ken Anderson is here, and I will ask him to jump in. But before he embarked upon that analysis, he contacted the County Public Works Department and was directed to use as the basis for that the county's recently certified general plan documents for the basis for traffic, studies and information counts in that area. But you're right, there's not a lot of accident history there because there aren't a lot of accidents. There certainly are some some site distance issues from the neighboring properties, but our property is probably situated at the best section for installing an encroachment along that section of O'Byrne's Ferry Road. And I think that Mr. Anderson, if the board would indulge, could weigh in on sort of his analysis that perhaps although it is signed at 55, people are not likely traveling that fast on average.
Let's see if I can be heard. Oops. Yeah, go ahead, Mr. Anderson. I appreciate you weighing in. A lot of details to cover here. One, yes, as Susan said, the traffic volume information cited as background in the document did come from the certified GPEIR and was not collected anew because, as you suggested, the time of the year when the data we could have done new counts was not going to be peak. That information didn't drive necessarily the safety evaluation and the need for access improvements. It was cited as a basis for sequel evaluation of the project's impact from a level of service standpoint. With regard to the speed issue, Susan made the point that the prevailing speed in the area is appropriate and goes along with the site distance that was observed at the locations. At the Planning Commission meetings, we noted that, yes, the posted speed limit in the area is 55. That's the standard rural speed limit that exists on the road. There are warning signs that suggest to drivers in various places on the curves as you're heading toward the dam that you want to drive slower. We actually went and did some supplemental work to measure the speed where the driveway is on a 24-hour basis using the pneumatic hoses you would see for car counts. And those confirmed that nearly every driver out there is driving no more than 50, and that the 85th percentile speed that we cited at the Planning Commission meeting is still the prevailing speed, as it were. It's an interesting situation because our point at Planning Commission was our site distances stay for the speed people drive, and the speed people drive is separate from that county-wide 55 mile an hour limit. And the evidence we saw said, realistically, if the county elected to, they could establish a formal speed limit in the area that would go with the 55 mile an hour limit. Within that context, the site distance in each direction is adequate for the speed people drive, and the amount of traffic that we forecast and expect to be turning into the site on a peak day doesn't reach the level that would warrant having a separate left turn lane. So, I recall how many cars tried to park along O'Byrne's Ferry Road, both on the Tuolumne and the Calaveras side before the boulders were put up and everything was done. So if I can translate over what my memory is of how many cars that is, what is your expected number of vehicles that are going to be rotating through that site per day? We had suggested in our report that each space might turn over 2 or 3 times a day. Checking my data here. Yes. So we were thinking we would get to the point where we would have 100 vehicle trips in and out of the site on a day. 100 and what? Excuse me? 100 vehicle trips. Okay. Vehicles coming in, 50 in and 50 out over the course of a day. I know my clients suggest that overstates the likely use, but that's the value that was used in our document. Should you get to a point of overuse or creating some type of traffic issues along O'Byrne's Ferry Road, my concern would be how to mitigate that in the future. I suspect, well, if I'm sorry, Susan.
I was just going to say that it goes back to the issue that we've spoken about quite some time is, this provides public access to the reservoir in a site permitted for that and allowed for that by right in the zoning district. But it is a finite resource there. We believe the reason why the trespass occurred for so often is that there wasn't an amenity on the Calaveras side of the reservoir. We will, though, as a part of our ongoing operation of the site, be looking to make sure our cameras are addressing unauthorized parking along that section of O'Burns Ferry Road. And we will be actively working with your Public Works Department, just as we have for the past almost 2 years now, because before we even submitted the project, we met with them out there and asked about traffic considerations, concerns, etc. So I just wanted to add that certainly, it's not a park where we install it and walk away like some other county parks. It's an amenity that we install but actively operate and maintain.
Yeah, I go back to the parking along O'Burns Ferry Road, not so much within the parking lot that you'll be providing, but over there towards the monument, towards Mr. Fraser's property. As they can't find places to park, they're going to find any place they can to park. And how do we be sure that we've mitigated that particular issue, considering the blind curve towards the bridge? As you go away from your property, you make that sharp hairpin turn there by the monument. We have cars parking in there now. Some of that is your property, some isn't. So I just want to be sure that we don't leave ourselves wide open to a lot of over excessive parking, because we have underthought how many people could potentially be using that location in a given day. I'm not convinced that the volume estimate that you've got here of 100 is really high enough to deal with what I've seen in peak use times, as you may have seen as well. So I'd like to see if you could address that for me.
I think, as Mr. Anderson indicated, it actually was a conservative estimate that is probably greater than we might expect. But we chose to proceed in that fashion to present a report to the county that was not understating our impact at all. So as Mr. Anderson just indicated, it is an conservative estimate, meaning not understated in any fashion. Given that there will be turnover during the day. Some people will come and spend the day, others will come, take some pictures, sit and look at the reservoir, and leave. We've taken data from across the country about how these parks operate, and we believe that the assessment is quite accurate. And I believe that's why, when it was evaluated by your Public Works Department, they accepted it as well. Given that it's prepared by a licensed traffic engineer, and so are your folks at the county. In terms of the parking, again, just as the county, I will refer to Tuolumne County in this regard, when the boulders were installed at Tridam's expense on the Tuolumne side, Tuolumne County Public Works had to install some no parking signs along O'Burns Ferry Road. Not just at the point where the bridge abutment is on the Tuolumne side, but they had to continue quite some distance up that slope to try and deter people. And it very well may be that your county Public Works Department may need to look at that, if it's a problem, but we will be doing all that we can to address it as the operator of the facility so that it does not cause additional work for your county staff.
Let me shift gears just real briefly. I'm about out of my questions, so thank you for bearing with me here. Is where your gate is located, the distance from that point of the gate to back to the main highway is about how far? 20 feet, 30 feet?
It's designed to meet the county requirements for a commercial driveway encroachment, and the gate is placed. This was also a topic of extensive discussion at both planning commission hearings. The gate will be set back far enough that if somebody comes with a truck and a trailer, they can pull off on the tapers of the encroachment, be in front of the gate and not pull in and not have to back onto O'Burns Ferry Road.
Are we going to then sign that area so that people know in advance of arriving there you cannot don't even think of turning left if you've got a trailer?
Not even turning left, but that was a discussion at the planning commission as well. There is going to be a sign at the gate before you get to the gate advising of such, that it's not intended to provide for a person, a big rig, for example, to come in and use the park, or a similar size vehicle. But it was discussed specifically at the last planning commission meeting in March. And the director, Mr. Packinger, was present and explained to the commission that the design and the commercial driveway encroachment will adequately provide for spacing, and so that, like I said again, someone pulling with a truck, pulling a small trailer or a boat can be totally off the roadway and can proceed safely back out onto the roadway using the tapers and the driveway encroachment, and the gate is set back to a far enough distance. And again, this will be part of, assuming we get approval, part of the detailed encroachment plans that are prepared by a licensed engineer and filed with your county public works officials. Making sure, we've committed to making sure it's compliant, but they will double check and make sure that we've complied with every provision in your code.
Thank you all for your very succinct answers. I'll leave it at that for now and
Thank
see if
you.
there's anyone
Are
else
there
who'd
any
like to.
members of the board who have follow-up questions for staff? I have one, Ms. Lindo. If Mr. Frazier provides documents that are different, either from his surveyor or a deed, what have you, though you already mentioned that are different than what Mr. Murphy and our land surveyor had agreed to, does that change any of the conditions of the permit or the project before us?
The access easement is described as a strip that is 15 feet wide from the edge of O'Byrne's Ferry Road. That's about all that it says. And I'm not a surveyor. I did not create the site plan. I'm not really clear on whether the location of the proposed storage structure would impede on that. Maybe Mr. Murphy could discuss this a little bit because he's reviewed the site plan and he's reviewed the deed and he understands the language a little bit more than I do.
The issue for me is sort of not whether it is or isn't, but that, as you had pointed out earlier, you had asked Mr. Frazier for additional or documentation that would show what we had, and our research was different. If something comes up in a week, a month, what have you, does that change any aspect of what is before us today that would require Tri-Dam or the county to go back and look at it? Maybe Mr. Maurer, could you get to that?
Well, assuming that there is additional documentation that would demonstrate that there is indeed an easement across the property as described by Madeline, the 15-foot wide strip parallel to and adjacent to O'Byrne's Ferry Road, it may require a modification of the site plan to ensure that any structures would not protrude into that easement or block the use of that easement. We have the ability to make minor adjustments to a site plan that's consistent with the approved project that the Planning Commission approved. If we can make a finding that's, it's minor. If it were a major revision, we might have to go back to the commission to approve a major revision if we find that there is indeed an easement across that property and it does affect the design of the project. So if there is an easement, that would exist and it could affect the project. all of our research, everything, the document that we've been able to see, the information provided by the surveyor, Mr. Murphy, indicates that there isn't an easement there. I know Mr. Frazier had asked to rebut that statement, and if there's information now, it would be helpful to have it so we don't have to come back, 3 or 4 or 6 months from now and revisit this thing. But again, we've asked him to provide us whatever documentation he has, and we haven't received anything other than the original deed that he submitted to us, last summer when he, indicated that he believed that there was an easement across it.
I think what I'm asking is if this could be handled as a sidebar to what is before us today, and if he comes up with something that could be not something that has to go through this process again, but would be a minor modification required of.
It is possible that could be the case, but without knowing the specifics of what we might find, if there's anything, I don't know. If it means a complete redesign of the project, and obviously outside of minor revision, it means going back to the commission for a revision, a modification to existing permit. Again, it's a matter of degree.
All right, thank you. If there's no questions or comments from the board or staff at this time, I want to close the public hearing.
Madam Chair?
Yes.
My apologies. I have an emailed public comment that I failed to see here in my notes. Could I read it at this time?
Yes, please. Thank you.
Okay. So this email is from Ron Roberts. It says, my name is Ron Roberts and I own a home in Peninsula Estates. I recently read online that the Planning Commission approved a park on O'Burns Ferry Road with a 4-1 vote. I can't imagine a more positive scenario. This will enhance the area and provide amenities to neighboring residences as well as the visiting public. To be able to accomplish this without using taxpayers' money is a win-win for the county and its residents. You have a trusted and respected organization giving back to the community. I hope the Board of Supervisors unanimously approves this development. And again, my apologies for not reading it earlier. It was stuck to another piece of paper.
Thank you. All right, if there's no further comments, I'm going to close the public hearing and bring it to the board for action.
Madam Chair, I believe
yes.
Supervisor Stopper has his hand up. Was that?
Oh, he does. I'm sorry. I'm sorry, Mr. Stopper. Please go ahead.
Well, it was mostly answered through the questions and answers you'd followed up on. I'm just looking at this. They say that easement would be the 15 feet directly adjacent to O'Burns Ferry. The site plan here shows no structures other than some vegetation here. It would be easily remediatable in the future if something as such was found. I don't foresee it being a problem. I mean, the only thing that's going over it is the road going in that's going to get paved over. So at this point, I don't see any more problems. But I was fine with you closing it down, and I would entertain you letting me make a motion, Madam Chair.
No, wait. No, you were chit-chatting. So when you finish chit-chatting, I'll close the public hearing. Have you finished chit-chatting? Mr. Stopper, is there anything else? Okay, colleagues, I'm going to close the public hearing unless I see a blue hand or margarita. Okay, the public hearing is closed. I'm bringing it to the board for action. Mr. Mills, this is in your area. Did you want to make a motion as a courtesy to you, please?
Thank you, Madam Chair. I am still deeply concerned about the traffic study, about the amount of potential traffic that could be in this area, and the traffic assessment being done in November. That is just something that, knowing the 4,500 cars per day that I've seen in numbers across the O'Burns Ferry Bridge, in a peak traffic period during the summer, this could easily turn into a real problem for the county.
Okay, Mr. Mills, I'm asking for action. And so there's.
I'm not prepared to support it at this time.
Okay, thank you, Mr. Mills. Mr. Stopper, it goes back to you, please.
Madam Chair, here, let me. I would like to make a motion to adopt a resolution denying the appeal by the Lakes Treatment Center, Bernadette Cataneo, Scott Fraser, and John Payne of the Planning Commission's approval of the plan development permit for a public day use recreational facility at Tola Reservoir.
A motion by Mr. Stopper. Is there a second?
Second.
A second by Mr. Garamendi. All in favor of the resolution denying the appeal, say aye.
Aye.
Oppose?
Aye.
Aye. You're denying. Wait, Mr. Tuffanelli, do you support the resolution or you're against it?
Support the motion. I support the motion by Supervisor Stopper.
Got it. Thank you. And Mr. Mills, you're in the negative, correct?
You lost your voice, Mr. Mills.
Oh, he's all right. He's in the negative on a 4-1 vote of the board. There's a resolution denying the appeal. Thank you. And good luck to all of you. Mr. Fraser, I do ask if you have documentation from your survey or yourself that you please present it to Ms. Flamborough for further consideration, modifications if needed.
I'll do that. Thank you.
This public hearing, I've already adjourned it. This item is adjourned. I'd like to move to the next item.
Thank you.
Thank you.
Thank you.
Thank you. Are there any staff comments? Any board comments that you would like to make on things that you are doing? Come up with something.
Madam Chair,
Yes, Mr. Mills.
I'm pleased to report that New Maloney's was opened over Mother's Day weekend. We had a very good turnout, both on the Calaveras and the Tuolumne side. It is interesting to note that Don Pedro at Bonds Flat had a 7.5-mile traffic jam, people trying to get their boats into Don Pedro over the weekend. However, a note of caution to the public, Natural Bridges on Parrots Ferry Road is closed. And this weekend, people were being ticketed. Understand it's a federal reservoir, which means it's a federal ticket. Does not necessarily mean you're going to end up in Calaveras County Court with it. So please, please, until you see notification that Natural Bridges is open to public use, do not park there and do not use that facility.
Thank you, Mr. Mills. Mr. Garamendi.
Thank you very much, Madam Chair. This is the junior livestock auction is going to happen on Sunday of this week. It is a new format. I'm not exactly sure how it's going to work, but I would encourage the public and my fellow supervisors to show up virtually and support our kids and all their hard work. They've had a heck of a hard spring, a lot of these kids who put a lot of their time, sweat, and tears into these animals. And even if you don't want to buy an animal, consider topping off or doing an add-on to some of those purchases, and let's help them out. They deserve our support, especially this year when they're out of school and don't get to enjoy the fair the way they traditionally have. So I hope that I get to see everybody's virtual hand raised at the auction.
Pressure's on. Thank you, Mr. Garamendi. Are there any other comments that the board would like to make? Mr. Stopper.
I just would like to concur with Mr. Garamendi. I've gotten lots of letters from the kids. It's a great way to support, the junior livestock, the FFA, and all these children growing up in Calaveras County. A great tradition, and you get some great meat out of the situation at the end of the year.
Thank you. Mr. Alt.
No, ma'am, I don't have anything.
Mr. K? Ms. Everett? Does Susan have anything? No. Okay, this meeting is adjourned, and we are going to be moving into closed session.
Would you like me to read the closed session items so that you can ask for public comment?
Oh,
And give us 5 minutes to hit the restroom before we start the next meeting, Maria.
will do.
Thank you.
Yes, please.
Thank you, Mr. Garamendi.
Okay. So, closed session agenda. Item 32, pursuant to Government Code Section 54956.9D1, conference with legal counsel regarding existing litigation, California Sport Fishing Protection Alliance, the Eastern San Joaquin Groundwater Subbasin Sustainability Plan et al. Stanislaus County Superior Court Case Number CV 20001720. Item 33, public employment. Pursuant to Government Code Section 54957B1, title Ag Commissioner, Director of Weights and Measures. Item 34, public employment. Pursuant to Government Code Section 54957B1, title Environmental Management Agency Administrator, Air Pollution Control Officer. Item 35, pursuant to Government Code Section 54956.95, Workers' Compensation Claim, Ansel Bowman, County of Calaveras, claim number 2018-200-1057. Item 36, conference with legal counsel, anticipated litigation, significant exposure to litigation, one case, pursuant to Government Code Section 54956.9D2. And item 37, conference with real property negotiator, pursuant to Government Code Section 54956.8, instruction to negotiator regarding potential purchase, price, and terms of payment for the following property affected by the State Route 4 Wagon Trail Realignment Project, Phase 1. Agency negotiator, Dockin Engineering Incorporated, negotiating party, and respective property APNs are as follows. Carol Sue Krim, trustee, the 2000 Carol Sue Krim Revocable Trust as to APN 053-001-064 and 053-001-067. Also, Gregory D. Jordan and Nuala M. Jordan, trustees, Jordan Revocable Trust as to APN 053-002-050. The next, Wendell F. Ender and Mary L. Ender as to APN 053-002-051. The next, Stephen L. and Gloria Stange, trustees of the Stephen L. and Gloria Stange Revocable Trust as to APN 053-002-053. The next property, Scott Frazier as to APN 053-007-023. The next, Edward R. Titus and Erlinda C. Titus, trustees of the Titus Revocable Living Trust as to APN 053-007-024. And the last property, Tiscornia Ranches, LP, as to APN 053-001-018, APN 052-001-019, APN 053-007-011, and APN 053-007-031.
Okay, if there are any public comments on these items, we'll wait a moment and give you a chance to call in. Who's going to be our host? Mr. Alt?
Yeah, I'll be. I suspect that's the case. We'll probably tag team it between Sarah and I since there's 6 items. 6. So we have to go to the other link that Rebecca sent us?
Yes, you will have to leave this meeting when it is adjourned and then go to the closed session meeting link after 5 minutes. Madam Chair, there are no public comments at this time.
Okay. Thank you for the reminder. This meeting is adjourned and we will go into closed session after an 8-minute recess.
So you'll reconvene at 3:20 into closed session?
3:20 into closed session. Thank you.
Thank you.
Do we